సో బేసిక్గా మీరు అనుకుంటారు బ్యాడ్ హ్యాబిట్స్ నాకంటే నా పక్కనున్న వాళ్ళకి ఎక్కువ ఉన్నాయి, నాకెందుకు డిసీజ్ వచ్చింది, నాకెందుకు డయాబెటీస్ వచ్చింది, నాకెందుకు ఒబెసిటీ వచ్చింది, నాకెందుకు స్ట్రోక్ వచ్చింది, ఆర్ నాకెందుకు ఆటోఇమ్యూన్ ఎన్సెఫలైటిస్ ఇలాంటివి వస్తున్నాయి అంటే, డయాబెటీస్ ఉన్న వాళ్ళు వీక్నెస్, నమ్నెస్ చాలా లైట్ తీసుకుంటారు. ఇది డయాబెటీస్ వల్లే వస్తుంది, అంతేలే ఇన్సులిన్ డోస్ పెంచేసుకుంటే సరిపోతుంది అనుకుంటారు.
Whereas stroke is sudden. Okay, the word stroke comes from strike. It strikes you like that.
Sir, I would like to ask about this thing that autism అనేది ఇవాళ రేపు పిల్లల్లో ఎక్కువగా వినిపిస్తున్న టర్మ్ అన్నమాట. సో దానికి ఫోన్ ఎంతవరకు కాజ్ అసలు? Is it true or is it a myth?
See, your gut produces a hormone called serotonin. Serotonin is important for your attention memory. So if you eat a lot of junk, you will destroy a lot of your gut microbiome. How to differentiate another headache, serious headache from a migraine or other types of headache? Ischemic stroke is basically because of other conditions like diabetes, hypertension, cholesterol, bad lifestyle, stress, all this can contribute, right? Doing what you can do the best to the patient. Once you know that you've done your best, you have to leave it on God.
Telugu Times ప్రేక్షకులకి నమస్కారం అండి. Welcome back to the podcast. So today we have another special and very interesting guest who came to just share his experience so far in the field of medicine. మనందరితో పాటు పంచుకోవడానికి తన ఎక్స్పీరియన్సెస్ అన్ని షేర్ చేసుకోవడానికి వచ్చారండి ఒక స్పెషల్ ఇంట్రెస్టింగ్ గెస్ట్. సో హీ ఈస్ అ బ్రెయిన్ స్పెషలిస్ట్, న్యూరాలజిస్ట్. సో మనకు తెలుసు బాడీలో అన్నిటికంటే ఒక ఫ్యాసినేటింగ్ ఆర్గన్ ఉంటుందంటే అది బ్రెయిన్ అండి. హౌ ఇట్ వర్క్స్, హౌ ఇట్ ఎఫెక్ట్స్ అవర్ డైలీ వర్క్, అదంతా మనతో మాట్లాడి దాన్ని ఎలా కంట్రోల్ చేయాలి, మేబీ సర్స్ పర్స్పెక్టివ్ ఏంటి, అదంతా చెప్పడానికి మనతో ఉన్నారు డాక్టర్ షకీబ్ అహ్రార్ సార్. Sir works for Glenfield Brain Heart Hospital and also he owns his own clinic, Neurospace Center, which is at Mehedipatnam. So without any further ado, we'll get into the podcast, Andy. So we will welcome Dr. Shakeeb Ahrar sir to the podcast. Welcome, sir.
Hi. Thank you so much for having me. To start with, I think I have to tell you that you're doing a very good job in terms of anchoring this podcast.
Thank you, sir.
And this podcast is giving me the traditional vibes of Doordarshan TV interviews that we used to watch as a kid. So congratulations to you on that. To start with, I am Dr. Shakeeb Ahrar. I am a neurologist by profession. I have finished my DM Neurology from Nizam's Institute of Medical Sciences. I work for Glenfield Mallaradi Brain Heart Hospital. It's in Nampalli. I have my own clinic called Neurospace at Mehedipatnam.
Sir, so you're working as a neurologist now. సో మీరు ఇంత దూరం న్యూరాలజిస్ట్ అయ్యి ఇక్కడ రావడానికి మీకు ఎవరైనా ఇన్స్పిరేషన్ ఉండినా సార్? హౌ డిడ్ యువర్ జర్నీ గో సో ఫార్ సో దట్ మీకు చిన్నప్పటి నుంచి బ్రెయిన్ స్పెషలిస్ట్ అవ్వాలి, న్యూరాలజిస్ట్ అవ్వాలి అని ఉండిందా సార్?
No, not even a doctor. I think to start with, the plan was to never become a doctor as such. It kind of like they say, you just fulfill your destiny. It does not start anywhere. It is just a journey that takes you somewhere. So I think as a kid, I wanted to become a scientist. And later on in my life, I think I had some interest towards aeronautical engineering. But some incident happened in my mother's life, and she kind of wanted me to become a doctor. That's how I took up this profession. It is kind of my mother's wish, you can say.
Oh, do you mind sharing it?
Never a plan.
Do you mind sharing it with us, sir? ఏం జరిగింది sir? What happened to your mother?
So until 9th or 10th standard, I think I decided that whichever subject I choose in the future will be based on how much I score in my 10th standard board exams. Like if I score more in maths, I'll go in that direction. If I score more in science, I'll go in that direction. So what happened was I scored 98 in both. Meanwhile, one tragedy happened. Like my mother's mother, she was admitted in a hospital in NIMS, the place where I did my neurology. And one fine night, I mean, she had a stroke, and my mother was all alone during that time. It happened overnight, and she did not understand what is happening, and there was nobody to support her during that time. It just happened in a jiffy. Like morning she was doing all good, and they were planning on discharging her. And suddenly what happened was she had a stroke, probably a massive one, It is never clear. I mean, she is not sure what exactly happened. So she thought that that night at least somebody should have been there from the doctor fraternity who could have supported her or at least told her what exactly is happening. Because sometimes you know that your fate is sealed, but you want somebody to share that fate with you, right? So she had that problem that day, and she expressed that desire with me in the following months that no, you should become a doctor, and that's how we chose this profession. So it was never a plan; it just happened.
How old were
And
you? I'm sorry to interrupt you. How old were you when
I
this
was
happened?
about 13, 14, just 9th or 10th standard.
Okay.
It was, yeah, it was in between 9th and 10th. I was in the summer holidays of 9th standard, I think.
Okay.
But the original plan was, like I said, I'll take up the profession based on my score at the end of 10th standard. But if you look at it, about 15 years later, I found myself in the same department where my grandmother expired, and while I was treating the same condition that she happened to go through. So like they say, life takes a circle. Like beginning is the end is the beginning, right? That's how it happened.
Sir, వాళ్ళ grandmother ki అమ్మమ్మ sir.
Yeah.
అమ్మమ్మ సార్ వాళ్ళ అమ్మమ్మకి స్ట్రోక్ వచ్చినప్పుడు చూసి ఆ టైంలో ఎవరైనా ఇంట్లో మెడిసిన్ తెలిసిన వాళ్ళు ఉంటే ఎలా ఉంటుంది, ఎంత హెల్ప్ఫుల్గా ఉంటుంది అని ఆ ఇన్సిడెంట్ నుంచి స్ఫూర్తి పొంది సార్ ఇవాళ న్యూరాలజిస్ట్ అయ్యారు. దట్ ఈస్ వాట్ సార్ ఇస్ సేయింగ్. సో ఇంట్లో ఏదైనా ఒక ఇన్సిడెంట్ జరిగినప్పుడు, అది కూడా యంగ్ ఏజ్లో 10 to 13 yearsలో, అది మన మీద చాలా ఇంప్రెషన్ చూపిస్తుందండి. అది మన ఫర్దర్ లైఫ్లో ఏం అవ్వాలి అనుకుంటున్నాం అనే దాని గురించి కూడా. అండ్ ఆల్సో ఆ టైంలో మనం గ్రాండ్ పేరెంట్స్కి ఎంత క్లోజ్గా ఉంటాం అనే దాన్ని బట్టి మన ఫ్యూచర్ డెసిషన్స్ చాలా వరకు డిపెండ్ అవుతాయండి. బికాజ్ మనం లాస్ట్ టైం చూసినప్పుడు కూడా ఒక సార్ చెప్పారు వాళ్ళ తాతయ్యకి బాలేదని చెప్పేసి అప్పుడు ఇన్స్పైర్ అయ్యాను. సేమ్ థింగ్ అగైన్ ఇక్కడ అమ్మమ్మకి బాలేదని చెప్పేసి డాక్టర్ అవ్వాలనుకున్నారు. దిస్ ఇస్ వెరీ ఇన్స్పైరింగ్ సార్. యాక్చువల్లీ ఇంట్లో జరిగిన వాళ్ళు దాని నుంచి ఇన్స్పైర్ అవుతాం మనం, అండ్ దట్ హ్యాస్ అ వెరీ స్ట్రాంగ్ మోటివేటింగ్ ఫ్యాక్టర్ మన లైఫ్లో ఏం చేయాలి అని దాని నుంచి. సో ఫర్దర్గా సార్, ఆఫ్టర్ గెటింగ్ ఇన్ టు MBBS, దెన్ యూ హ్యాడ్ ఇంక్లినేషన్ టువర్డ్స్ మెడికల్ సబ్జెక్ట్స్ సార్?
No, initially I wanted to become a surgeon.
Surgeon.
Yeah.
Okay.
But what happened was, initially when you become an intern, you have this opportunity of putting sutures on trauma patients, right?
Yes, as an intern.
So I saw that I'm having tremors whenever I'm trying to put sutures. So one interesting observation is that a lot of the surgeons who are successful, they have this innate ability to operate. It's their hands are God gifted, right? So I have my friend who is a surgeon, and he used to dissect through the dead body. I mean, during the anatomy dissection classes, layer by layer, he was quite good at it. Like we used to just chill around the table. This guy used to sit and go through all the layers of the skin and muscles and all that, dissecting everything. And we knew that he'll become a surgeon one day. And he's a surgeon now. He's doing quite well in the UK. So I thought, I'm not God gifted, so I cannot take up this field. I thought if I'm choosing a subject, I should be rather good at it. I don't want to be a mediocre surgeon, right? So that's why I dropped the plan of surgery. Meanwhile, I was, you know Dr. House series, right?
Yeah.
I was fascinated by it. I used to watch it all day, like all the episodes over and over again.
Yeah.
So much that I imbibed Dr. House's character inside.
Yeah. Yes.
I'll tell you, I mean, you won't believe it, but at one point I was feeling pain in my leg.
Okay.
With this character, because in this series he has a leg pain.
Yes.
And he's on drugs.
Yeah.
He takes a lot of analgesics, opioids and all that. So I imbibed that character inside me so much, right? I felt that leg pain inside in my left leg. I should not tell, but I was taking painkillers for this.
Okay.
There a couple of times in Medicity I took injections.
Okay.
And once upon a time I took an opioid as well, which caused me vomiting, and it was a bad vomiting. Then I said, I'm never going to take an opioid again, whatever the pain is. So Dr. House is what inspired me to take medicine. So I wanted to take up diagnostic medicine like he did. I wanted to be a detective like this, going through diseases, intricate symptoms, and coming to a conclusion and all that. So that's how I wanted to be, and that's why I chose medicine. And eventually, I mean, like I said, neurology was never the plan. See, if people ask me how I chose this subject, I say it's not you who chooses the subject. It is the other way around. It is the subject which chooses you. It is tailor-made for you. Now, when I look back, if you give me an option, would you choose surgery if your hands were stable? No. I would still take neurology. So much I like neurology now. I'm just fascinated by it. Right? So, like it's like Harry Potter's wand. You do not choose a wand. It is the wand which chooses you. Same thing applies to medical fields, I think. You just fit into it like pieces of a puzzle. You belong where you are.
Yes, sir. Yeah. So subject choose చేసుకునేటప్పుడు సార్ చెప్తున్నారు, subject will choose you sometimes. It's not you who choose the subject. So మనం అనుకుంటామండి అన్నీ మనకి తెలుసు మన choices అని చెప్పి, కానీ how well you know about yourself will actually tell you what you can do better. Like ఇప్పుడు సార్ కేసులో సార్ సర్జరీ పట్ల he was not that much interested. He wanted to solve a fresh case every day. అలా ఇంట్రిగింగ్గా ఉండడము, ఇంట్రెస్టింగ్గా ఉండడము, దట్ ఈస్ హౌ హీ చోజ్ హిస్ మెడిసిన్ పాత్వే. సో అలా ఒక్కొక్కరికి ఒక్కొక్కటి ఉంటుందండి. ఇఫ్ యూ డీప్లీ లుక్ ఇన్ టు యువర్ సెల్ఫ్, వాట్ ఈస్ ఫ్యాసినేటింగ్ యూ ఎవ్రీ డే, వాట్ ఈస్ యాక్చువల్లీ మేకింగ్ యూ లివ్ యువర్ లైఫ్ in a most exciting way every day, that should be the place where you have to be. That should be the subject where you choose. And also మీరు చూస్ చేసుకోవడం కాదు, అది కూడా మిమ్మల్ని చూస్ చేసుకుంది. దట్ మీన్స్ దట్ ఈస్ ఇంట్రిగింగ్ యూ, అది మిమ్మల్ని ఇంట్రెస్ట్ చేస్తుంది. సో దట్ ఈస్ పికింగ్ యూ అప్, దట్ ఈస్ వాట్ ఇట్స్ ద అదర్ వే రౌండ్ అని చెప్పి. ఇట్స్ వెరీ వెల్ సెడ్ సార్. యాక్చువల్లీ ఫర్ ది పీపుల్ హూ ఆర్ ఇన్ కన్ఫ్యూజ్డ్ స్టేట్ అగైన్, మెడిసిన్ ఆర్ సర్జరీ అన్నప్పుడు యు నో వాళ్ళు ఒక నిమిషం ఆలోచిస్తే వాళ్ళకి అర్థం అవుతుంది, ఇదా నన్ను ఇంట్రెస్ట్ చేస్తుంది, ఇదా నన్ను, దెన్ మేబీ దే కెన్ కమ్ టు అ క్లియర్ పిక్చర్.
Correct. It's all destiny.
How was your medicine residency days, sir? Is there any day where you remember that case very well, that you'll never forget that case like that?
So I was in my final year.
Yes.
Final year lo, I'll use Telugu in between.
Yeah.
Final year lo unnappudu I was seeing a patient who had come with he basically had come in a collapsed state. He needed a ventilator. And we had absolutely no clue on what was happening with him, because I was a resident. You may not know a lot of things when you are a resident, right? And he got admitted, and actually it was a tetanus case. He had stiffness all over his body, and he was folding. We call it opistotonus posture, where you fold your body like this. Right? It was a new case for me. I never saw a tetanus in my life. And I'll tell you how I diagnosed it. I did not diagnose it while I was with the patient. I slept that night. I got a dream saying, this is there, this could be tetanus. I was on duty. So I ran to the patient. So, this is tetanus, I said. The brothers and nurses were like, what is wrong with this guy? He just got up at 4 or 5 in the morning. He's saying tetanus. So, I kind of diagnosed. I mean, it was looking quite obvious from what I read again. I sat there and read again, and he was fitting into tetanus. And there is no treatment as such. Once the tetanus is set in, you can give them benzodiazepines and all that, which was not available. You can give immunoglobulins, which cannot be given because it's not easily available. And you can also give spinal injections. So we called up anesthetist, and he was on duty, but he said it's something new to him, and we waited till morning 9 o'clock. The senior assistant professor came. I don't remember. I think we gave intrathecal baclofen or something to relax his body. But everything happened, and he happened to succumb to this disease by next day morning. So I think sometimes sometimes dreams give you answers.
This is again new to hear, sir.
Yeah, I mean, if you think about something, if something is bothering you, and
subconsciously maybe
your mind is thinking, your mind is thinking, and you'll get an answer in your dreams. Yeah. I think even
Okay.
Islamic perspective, if I put in, you have this where you put a prayer and ask God, I'm going through this. What do you say? And you will get an answer inside your sleep. It is proven Islamically, but that is what happened. So that is one of the diagnoses that I'll remember, because I happened to diagnose on my own through my dream. So that case I'll remember forever. And once he collapsed, once he died, I cried like a baby that night.
Okay.
I cried like a baby for an hour. Yeah.
సో ఐ థింక్ పేషెంట్స్ ఇక్కడ ఒకటి అర్థం చేసుకోవాలండి. ఒక కేసు ఏదైనా చూసినప్పుడు వాళ్ళు ట్రై చేస్తారు, వాళ్ళు 100% అది ఇది అన్న ఎలాగైనా పేషెంట్ని రివైవ్ చేయాలి అని. దట్ ఈస్ దేర్ నాట్ జస్ట్ అకాడమిక్ ఇంట్రెస్ట్ అండి, పర్సనల్గా కూడా వాళ్ళు కంపాషనేట్గా ఉంటారు. ఎలాగైనా నా 100% నేను చదువుకున్నదే కాదు, నా ఎక్స్పీరియన్స్లో చూసిన అంతా పెట్టైనా ఈ ప్రాణాన్ని బ్రతికించాలి అని. అది ఫెయిల్ అయినప్పుడు పేషెంట్ అటెండర్స్ ఎంత బాధపడతారో, ఎంత ఎఫెక్ట్ అవుతారో, డాక్టర్ ఈక్వల్గా ఎఫెక్ట్ అవుతారండి. మేబీ దే ఆర్ ట్రైన్డ్ ఇన్ సచ్ వే దట్ ఎమోషన్స్ వెంటనే పేషెంట్ ముందరే చూపించకుండా ఉన్నా కానీ పక్కకి వెళ్తే వాళ్ళకి ఆ కేసే గుర్తుంటుందండి కొన్ని రోజుల వరకు డెఫినెట్గా. ఎందుకంటే వాళ్ళు ఆ కేసుని థరోగా చూసి స్టడీ చేసి ఏమేం చేయొచ్చు అన్ని విధాలుగా ప్రయత్నించి తర్వాత ఫెయిల్ అవుతుందంటే అప్పుడే అనుకుంటారు వాళ్ళు కూడా వీఆర్ నాట్ గాడ్స్ అని. బట్ దెన్ దే ఆల్సో ప్రే ఫర్ ద పేషెంట్స్ వెల్ బీయింగ్ అండ్ ఫర్ ద పేషెంట్స్ స్పీడీ రికవరీ. సార్ ఇప్పుడు చెప్పింది కూడా అలాంటి సినారియోనే. సార్ కూడా గంట సేపు ఏడ్చారంటే దిస్ షోస్ హౌ మచ్ పేషెంట్ will play an impact on the doctor's life also, personally, emotionally.
Yeah.
Yes, sir. So that is one case you remember forever.
Yeah.
మీకు ఇలాంటి కేసెస్ రోజు చాలా వస్తాయి కదా, ఎస్పెషల్లీ.
Once I got into neurology, you happen to see a lot of such cases now. Now what happens over a period of time, you keep experiencing these things. Eventually you'll become numb to these things.
Adi.
Like
yes,
this happens, you pull yourself up, go to the next patient,
yes,
and see what you can do the best. That is the only thing you can do. You cannot carry that emotional burden with you to the next patient,
yes,
because it will affect his prognosis or diagnosis.
Yes, sir.
So you have to move on. I mean, it sounds bad that you become numb to whatever the patient is experiencing, but if you do not do that, it will take an emotional toll on you. It will affect your work. So you have to move on, no matter what. Doing what you can do the best to the patient. Once you know that you've done your best, you have to leave it on God. You, as a doctor, you feel that you're omnipotent, that everything is under your control. You're doing it, so he should give you reward. What you should understand is, just because you worked hard does not mean you'll get a reward. You have to accept failures as well.
Yes.
Just like you accept success. So that is what this patient taught me. That is what one more patient taught me, like an year back. Another interesting case, if we can share. Yeah, I'll tell you another story. Right, so about 1 year back, there was another patient, an interesting case again. This guy was 28-year-old. He had come in an unconscious state. He was in another hospital. I had gone there to visit another patient who was my colleague. And these guys, attendants, they met me on the way. And they explained that this is happening, they're not able to diagnose. Can you please help us? I said, okay, we can shift the patient to our hospital. I'll do my best, whatever I can. So వాళ్ళు తీసుకొని వచ్చారు పేషెంట్ని, and he was unconscious. No responses at all. He was on ventilator. No pupillary response. Pupillary response is basically when you put light into somebody's eye, your pupil constricts. There was no response. Dulce was absent. He was not taking breaths on his own. So we admitted him into ICU, and I went through his symptoms. I went through his history. There was one interesting history that they mentioned. About 2 to 3 weeks prior to this, he had some abnormal behavior. He was a painter by occupation. And he was
by occupation.
Yeah, he was painting, and he was getting lost while he was painting.
Okay.
And he was talking jargon every now and then that these people are not understanding. They thought maybe he's on
jargon ante ఏది పడితే అది మాట్లాడడం.
ఏది పడితే అది మాట్లాడుతున్నాడు. They did not take it seriously. They thought he's probably doing drugs, which we also thought initially. Probably he did some drug overdose, and that's why he collapsed. Apart from that, he was behaving irrelevantly. He was getting confused. ఎక్కడ వెళ్ళాలో తెలుస్తలేదు. One room to another, he was getting confused, and he was having short-term memory loss. He was not understanding. He was forgetting on whatever he's doing. Some episodes where his project is, I mean, like all those, I mean, how much money he lends to people and all that. So there was some memory loss, behavioral problem, and visuospatial disorientation, where you forget ways. So if I'm going out of this studio, I know that I have to take a left to exit this place. They will lose that orientation.
Okay.
They'll go right, they'll go here and there. That is called visuospatial disorientation, which your brain controls. He had this problem. And 2 weeks later, 2 weeks tarvata, he collapsed like this, and then he took him to the hospital.
Okay.
So that is one interesting history, because that made us think maybe it is a condition called autoimmune encephalitis,
Okay.
where your body is producing some toxins or antibodies which are attacking your brain. Okay? It's a self-attack. Your immune system is going haywire. It is not under control. So immune system is attacking your own body.
Yes, sir.
So we concluded that it is possibly autoimmune encephalitis. And being a painter, he had come from a very modest background. The treatment is expensive. So we explained it to them that the only treatment option he has is plasma exchange,
Plasma exchange.
where it's kind of dialysis, where you filter all the toxins and antibodies, and patient will recover within a span of a week or so,
Okay.
if they happen to respond to this therapy. But it is quite expensive for them, because it will cost around 2.5 lakhs or 3 lakhs, the total number of sessions.
Yes, sir.
So we advised plasma exchange to them, and somehow they took loan from here and there. They managed with all the money, because he is quite young, and they wanted to put everything whatever they have.
Okay.
So we started plasma exchange. We honestly did not expect much of a response, but to our surprise, 2 to 3 days later, he started opening his eyes.
Okay.
From nothing to opening eyes. So we said, okay, this is working. We'll continue whatever we are doing. So third cycle happened, fourth cycle happened. We removed the ventilator. He was off ventilator. And we thought, this is done. This is autoimmune encephalitis. He'll respond. He'll go out of the hospital. But during the 5th cycle of plasma exchange, he had some autonomic disturbances. Autonomic disturbances ante your BP and heart rate atu itu avutundi. It will fluctuate. And will collapse. So he had some arrhythmia, I believe. Arrhythmia is irregular heartbeat, and he collapsed. We did CPR and we could not save him.
Oh, okay.
So, I mean, we put everything, whatever we had, to get this patient out. But it was almost like he's recovering, and then he collapse is gone. Like the life is lost. You've done your everything. Your patient attendants have done everything, but you could not save him. From that day, I realized life is all fragile. I mean, no matter what you do, you will go when your time comes. And as a doctor, you should understand that, again, like I said, you're not omnipotent. You cannot, what do you call? You cannot save all the lives.
Yes, sir.
You can do your best and expect the best, but sometimes it is not in your hands. Life is all fragile. So, like I said, again, you have to be numb to this. You have to pull yourself up and put your interest into the next patient. So that is one case I'll remember again, because I saw from nothing to something and then nothing again.
I think this is one particular థింగ్ అండి. ఏంటంటే ఈ ప్రొఫెషన్లో అకాడమికల్గా ఎంత స్ట్రాంగ్గా ఉన్నా కానీ హ్యుమానిటీ పరంగా కూడా అంతే సాఫ్ట్గా ఉంటారండి. ఎందుకంటే ఒక ఎమర్జెన్సీ రూమ్ దగ్గర ఒక పేషెంట్ వస్తే ఫస్ట్ వాళ్ళు చూసేది కేవలం ఏజ్ ఏంటి, జెండర్ ఏంటి, అంతే అదొక్కటే ప్రిలిమినరీ డేటా వాళ్ళు చూసుకుంటారండి. మీరు ఎక్కడ ఏంటి, ఏ ప్రాంతము, ఏ రిలీజన్, ఏ కాస్ట్, ఏ సబ్ కాస్ట్, ఇవేవి పట్టించుకోరండి. హాస్పిటల్ ఇస్ అ ప్లేస్ వేర్ పేషెంట్ వచ్చినప్పుడు ప్రిలిమినరీ డేటా ఏంటి, ఎంత వయసు ఉంటుంది, అటెండర్స్ ఎవరైనా ఉంటే వాళ్ళు కూడా లేరు. జస్ట్ రోడ్ ట్రాఫిక్ యాక్సిడెంట్ అంటే జస్ట్ డైరెక్ట్గా పేషెంట్ని పట్టుకొని వచ్చి బాడీ ఎలా ఉంది, హెల్త్ ఎలా ఉంది మాత్రమే చూసి వాళ్ళు ట్రీట్మెంట్ స్టార్ట్ చేస్తారు. అది కూడా వాళ్ళకున్న స్కిల్స్తో, అకాడమిక్ స్కిల్స్తో. సో దిస్ ఇస్ ద ఫస్ట్ ప్లేస్ ఆఫ్ హ్యుమానిటేరియన్ సర్వీస్ దట్ ఐ ఫీల్. ఎందుకందరూ నమ్మరు, భయపడతారు డాక్టర్స్ని నాకు అర్థం కాదండి. అందరూ వాళ్ళ బెస్ట్ పెడతారు, వాళ్ళకు ఉన్న సబ్జెక్ట్ అంతా పెడతారు. ఎందుకంటే రివైవ్ చేయడానికి, పేషెంట్ని లైఫ్ని రివైవ్ చేయడానికి. మనకి ఇప్పుడున్న మీడియా కవరేజ్ వల్ల అందరూ ఏమనుకుంటారంటే హాస్పిటల్కి ఎమర్జెన్సీ టైంలో వెళ్ళాలంటే కూడా భయపడతారు. హాస్పిటల్కి వెళ్తే ఫస్ట్ బిల్ ఎంత వేస్తారో అని భయపడతారు, ప్రాణానికి ఏమవుతుందో అని పట్టించుకోరు, ఫస్ట్ బిల్ గురించి ఆలోచిస్తారు. ఎందుకు అంత భయపడతారండి? ఇంత చదువుకుని ఇంత ఎఫర్ట్స్ పెట్టుకుని ఫస్ట్ పేషెంట్ని మాత్రమే బ్రతికించడం కోసమే వాళ్ళు ఒక 40 years ఆఫ్ లైఫ్ వాళ్ళు స్కిల్స్ అక్వైర్ చేసుకుని వాళ్ళు ప్రయత్నిస్తూ ఉంటారు, ఎవరైనా ఏ స్పెషలిస్ట్లు అయినా. సార్ ఇప్పుడు చెప్తుంటే సార్ చెప్తున్నారు, ఆవేదన కనిపిస్తుంది మనకి. అంటే నేను ఎంతో ప్రయత్నించాను, నాకు తెలిసిందంతా నేను చేశాను, అటెండర్స్ని కూడా కౌన్సిల్ చేసి ప్లాస్మా ఎక్స్చేంజ్కి పెట్టాను, బట్ అయినా రివైవ్ అంటే వాళ్ళ చేతుల్లో ఉన్నదంతా ప్రయత్నిస్తారండి, కొన్నిసార్లు అవ్వదు. ఎందుకు వాళ్ళు అలా నంబైపోతున్నారంటే, ఎందుకు డాక్టర్స్ అలా నంబైపోతారంటే వాళ్ళు 100% పెట్టినా వాళ్ళ చేతుల్లో లేదు అని వాళ్ళు తెలుసుకున్నప్పుడు ఆ స్కిల్స్ ఇంకొకరికి ఉపయోగపడతాయి అన్నప్పుడు దిల్ క్విక్లీ కమ్ బ్యాక్ టు దేర్ సెన్సెస్ అండ్ దిల్ స్టార్ట్ వర్కింగ్ ఆన్ అదర్ పేషెంట్. సో దట్ ఈస్ ద థింగ్ దే డూ ఓన్లీ టు స్ప్రెడ్ దేర్ నాలెడ్జ్ అండ్ టు సేవ్ మోర్ లైఫ్స్. అంతేకాని కమర్షియల్ అని కాదండి. దట్ ఈస్ వాట్ ఐ వాంటెడ్ టు హైలైట్ అట్ దిస్ పాయింట్. సో సార్, మేబీ ఇఫ్ యూ కెన్ కంటిన్యూ అండ్ షేర్ సమ్ మోర్ ఎక్స్పీరియన్సెస్ లైక్ దిస్.
I mean, apart from these, you'll also have happy experiences, right?
Yeah, happy experiences also.
Yeah.
Yeah, you need to share that also.
Correct. So,
మాకు తెలుస్తుంది.
Similar patient, there was recently about a 13-year-old female patient. Again, she had come in an unconscious state, practically unconscious, no response, and tanaki seizures వచ్చాయి చాలా back to back. So because of the seizures, she fell unconscious. దీన్ని status epilepticus అంటారు. Like back to back seizures వచ్చినప్పుడు your brain practically retires, it collapses and you collapse. So she had come in unconscious state again, we intubated her and there were no responses apart from pupils. Pupils, like I said, if you put light, your pupil will constrict. So again, we digged into her past history. She had similar complaints that about 2 to 3 weeks prior to this, tanaki fever ochindi. Fever to part 2, she had brief episodes of confusion. Same, she was talking jargon, irrelevant, and then she was back to normal again. It was not sustained, so they did not heed into it much. They thought maybe because of fever she had that burden on her head. So about 2 to 3 weeks later from that episode, the fever episode, she collapsed with multiple seizure episodes. Again, the question was autoimmune encephalitis, and we sent all the investigations. We have a panel now. Like these are relatively newer diseases. Probably దీనికి టెస్ట్ అనేవి 10-15 years prior to this లేవు. Everything was based on clinical history, sometimes MRI imaging and all that. But now we have antibodies, the toxins I talked about. You can test them.
Yeah. Yes.
Right? So we tested that and she got NMDA positive antibody. It's an auto antibody syndrome. Your body is producing NMDA antibodies. NMDA is a receptor in your brain. So because of these antibodies, your brain receptors are getting affected. So you lose control over your brain. You will have seizures, all sort of abnormal behavior, memory loss and all that. She had majority of these symptoms and it came positive. We gave her a treatment called IVIG and she responded dramatically. Her seizures got controlled. She came out of ventilator in a matter of week. Discharge చేసాము. I thought because of all this, she might have some memory problems. Because post seizure activity, post autoimmune encephalitis, చాలా మందికి memory loss ఉంటుంది. Because of back-to-back seizures, your brain is practically damaged in one way or the other. So long-term implications ఉంటాయండి. You will have memory loss, you will have behavioral problems. Something depends on which part of your brain is involved. So I thought she'll have memory loss or some sort of baseline problems once she gets discharged. But a month later, she came back. She was all normal. Although she did not remember that she was in the hospital. That short-term memory loss was there. But long-term wise, she remembered everything. Practically normal. So, like I said, sometimes it is rewarding, sometimes it is not. But you should focus on rewards more and pull yourself up when it's a failure. So that is one positive aspects of neurology, that you have a lot of treatable cases as well. Ante people believe that neurology is all untreatable conditions. Emuntai peddaga migraine is not treatable, spits is not treatable. It's not like that. It depends on how you diagnose it and how you treat it. Now she's practically normal. She is on immunotherapy. Immunotherapy is basically a treatment where you stop these antibodies from getting produced more. So she's normal now. So there are brighter aspects to your field, any field for that matter, to your field or to neurology as well. So,
sir, now that we have come to this new autoimmune diseases topic, I just wanted to ask you one question. ఈ autoimmune diseases అనేవి ఇప్పుడు ఎక్కువ అవుతున్నాయి కదా sir? Even in neurology, autoimmune neuropathies and all. So what could be the reason for this? Also in younger adults encounter ఎక్కువ అవుతున్నాయి ఇవి autoimmune diseases అవి.
Yeah. So like you said, there is increased incidence of autoimmune conditions, not just in neurology, in other fronts as well, nephrology or connective tissue disease, rheumatology and all that. One thing is, yes, there is increased incidence, but we also have improved diagnostic capabilities to diagnose this condition. Like I said, 10-15 years back, we did not have a lot of this tests like antibody testing and all that. Now we have it. And 10-15 years back, we did not have this specific criteria to diagnose and treat this condition. Now we have it. So I think it is advances in science which is helping us diagnose more patients of autoimmune encephalitis. At the same time, there is increasing number of autoimmune diseases as well. So why is it happening more? I think one of the reasons is our lifestyle. So we are sleeping less, we are eating junk, we are stressed out, we are not going around walking, exercise, nothing. We are practically on our phone or online all day. We do not have much sort of external communication with the world. It's more of a virtual communication, right? You're practically living in a virtual reality. So all these are contributors to your risk of autoimmune encephalitis. So all these things per se won't cause autoimmune encephalitis, but they can lower your threshold of getting an autoimmune condition. Like if you have this, you are at risk.
Yes.
But you should also have some genetic predisposition. Like if your genes are bad and your genes are contributing to immune dysregulation, you are at a threshold, right? And to cross the threshold, there is a trigger factor. That trigger can be sometimes stress, sometimes lack of sleep, sometimes even a viral infection. So there is a trigger. Usually, we see that most of the patients with autoimmune encephalitis have had some recent history of fever or they were stressed out. Like this girl was stressed out about her exam. She also had a viral infection, but she was stressed out about her exams. And the other guy was stressed out about finances, the painter guy. So stress is one of the factors, but not the only factor. One of the factors. So if your immune system is already dysregulated and you're doing all this, you are at risk of getting an autoimmune condition. So lifestyle is one of the factors, definitely.
So this is also an important cause for stroke and also other diseases.
Yes.
Stress.
Yeah. In a way, because stress alone won't cause a stroke, but it is what you do with stress, how you take care of stress, which is more important.
Yes.
If you're stressed out, you won't sleep appropriately, right? You will eat junk. A lot of them have cravings for sweet or artificial beverages and all that. So you put on weight and you won't go out walk. You're not inspired enough to go out and walk and exercise because you're stressed. You just want to be in your comfort zone. So you work out less. You're eating, like I said, junk. All this can increase your risk of a condition called metabolic syndrome, where you are at risk of diabetes, hypertension, obesity. Already Indian people we have more fat percentage in terms of body weight as compared to the rest of the population. So you're already at risk of metabolic syndrome. And beyond that, if you're stressed and your lifestyle is bad, it will contribute to diabetes and hypertension, other diseases, and you are at risk of stroke. So that is how stress contributes indirectly.
Yes, sir. సో ఐ థింక్ ఇప్పుడు మనం సమరైజ్ చేసుకుంటే సార్ చెప్పింది ఒకటే విషయం అండి, స్ట్రెస్ అనేది ఎంతవరకు ఎఫెక్ట్ చేస్తుంది అంటే కంపారిజన్స్. సో బేసిక్గా మీరు అనుకుంటారు బ్యాడ్ హ్యాబిట్స్ నాకంటే నా పక్కనున్న వాళ్ళకి ఎక్కువ ఉన్నాయి, నాకెందుకు డిసీజ్ వచ్చింది, నాకెందుకు డయాబెటీస్ వచ్చింది, నాకెందుకు ఒబెసిటీ వచ్చింది, నాకెందుకు స్ట్రోక్ వచ్చింది, ఆర్ నాకెందుకు ఆటోఇమ్యూన్ ఎన్సెఫలైటిస్ ఇలాంటివి వస్తున్నాయి అంటే నా లోపల ఉన్న జీన్స్ థ్రెషోల్డ్ అనేది తక్కువ ఉంది. అంటే హై థ్రెషోల్డ్ ఉన్న వాళ్ళకి కొంచెం ఒక లెవెల్ ఆఫ్ ఎక్కువ స్ట్రెస్ తీసుకున్నా వాళ్ళు తీసుకోగలుగుతారు. నాకు ఏదైనా వచ్చింది అంటే నా థ్రెషోల్డ్ తక్కువ ఉంది, నా జీన్స్ ఆర్ కాంట్రిబ్యూటింగ్ ఫర్ దట్ డిసీజ్ అని. సో ఇది సింపుల్ గా అర్థం చేసుకోవాలంటే మీరు ఫస్ట్ కంపేర్ చేసుకోవద్దండి. ఒక్కొక్క బాడీ ఒక్కొక్కలాగా రియాక్ట్ అవుతుంది స్ట్రెస్ కి. సో ఏ రకమైన స్ట్రెస్ అయినా మీకు ఏదైనా బాడీలో మిమ్మల్ని మీరు అబ్జర్వ్ చేసుకుంటే ఏదైనా తేడా కనిపిస్తుంది అంటే మీరు వెళ్ళి చెక్ చేయించుకోవాలి. నేను బాగానే ఉన్నాను అనుకోవడం కాదు, ఎర్లీగా చెక్ చేయించుకుంటే ఆటోఇమ్యూన్ డిసీజెస్ కానీ స్ట్రోక్ వచ్చే ఛాన్సెస్ కానీ ముందే బయటపడితే మీరు దానికి తగ్గట్టు వర్క్ చేయొచ్చు. అండ్ ఆల్సో ప్రతిదీ ఈజీగా చెప్పేస్తారండి, నువ్వు తిండి సరిగా తినట్లేదు, నువ్వు అందుకని వీక్ అయిపోతున్నావు, నువ్వు తిండి సరిగా ఎక్కువ తింటున్నావు అందుకని ఒబీస్ అయిపోతున్నావు, ఇలాంటివన్నీ కాదండి. ఒక్కొక్క బాడీకి ఒక్కొక్క లెవెల్ ఉంటుంది, టాలరెన్స్ కానీ థ్రెషోల్డ్ కానీ, దానికి తగ్గట్టు వాళ్ళ బాడీ అలా డెవలప్ చేసుకుంటున్నాయి కొన్ని డిజార్డర్స్ అనేది. అది పూర్తిగా వాళ్ళ తప్పు కాదు, వాళ్ళ జీన్స్ జెనెటికల్ గా ఇన్హెరిట్ చేసుకునే దాని వల్ల ఇలాంటివన్నీ సంభవిస్తూ ఉంటాయి వాళ్ళకి. సో సార్ కూడా అది చెప్పారండి, స్ట్రెస్ అనేది ఇంపార్టెంటే కానీ స్ట్రెస్ ఒకటే ఫ్యాక్టర్ కాదు ఇవన్నీ రావడానికి అని. సో ఐ థింక్ దట్ ఈస్ వాట్ యూ సెడ్ నో సార్. సో ఇప్పుడు మీరు పేషెంట్స్ కి కౌన్సిలింగ్ ఇచ్చేటప్పుడు సార్, లైక్ ఫర్ ఎగ్జాంపుల్ మీరు ఒక విండో పీరియడ్ ఉంటుంది అని, ఆ లోపల వస్తే బాగుంటుందని, మీ ట్రీట్మెంట్ ఇచ్చాక కానీ ఇలా ఉంటే ఇంకొకసారి ఎప్పుడైనా ఈ లోపలే రండి అని, హౌ డూ యూ కౌన్సిల్ పేషెంట్స్ అబౌట్ దిస్ విండో పీరియడ్ సార్? యూజువల్ గా మీరు ఆ టైంలోనే పేషెంట్స్ ని చూస్తారా లేకపోతే బియాండ్ దట్ విండో పీరియడ్ చూస్తారా?
Usually we see, I'm talking about stroke, right? Stroke. Again, I think the world should know what stroke is.
Yeah, so stroke ante enti akkadi nunchi cheppandi.
Yeah.
Yes sir.
So stroke ante it's basically a condition where blood supply to your brain is disrupted because of some reason. So depending on the cause you have two types, ischemic and hemorrhagic. Ischemic ante మీ brain ki poye rakta nalu, the blood vessel is blocked, right? Hemorrhagic ante same rakta nalalu is getting ruptured. It's leaking. Right? The leakage is usually because of hypertension, which is kind of ignored, or maybe never taken care of. And ischemic stroke is basically because of other conditions like diabetes, hypertension, cholesterol, bad lifestyle, stress. All this can contribute, right? So the window period applies to ischemic stroke. So మీ వెజల్ కనుక బ్లాక్ అయిపోతే, ఇఫ్ యూ కమ్ టు ద హాస్పిటల్ విత్ ఇన్ ఎ స్పాన్ ఆఫ్ 4.5 hours ద గోల్డెన్ విండో పీరియడ్ టైం, ఆ టైం లోపు మీరు హాస్పిటల్కి చేరితే వీ కెన్ గివ్ యూ అ స్పెషల్ ఇంజెక్షన్ అండి, దట్ ఈస్ కాల్డ్ క్లాట్ బస్టర్. సో యూ గివ్ దిస్ ఇంజెక్షన్ అండ్ ద వెజల్ దట్ ఈస్ బ్లాక్డ్ విల్ ఓపెన్ అప్ ఇమీడియట్లీ, అండ్ దెర్ ఈస్ ఆల్మోస్ట్ 60-70% ఛాన్స్ దట్ మీరు నార్మల్ అయిపోతారు, వాట్ ఎవర్ సిమ్టమ్స్ యూ మైట్ హ్యావ్ కమ్ విత్. That brings me to what symptoms a patient of stroke may come with to the hospital. So universally, oka mnemonic undi that is followed worldwide. Be fast, BEFAST. B is balance. Ante nadustu you're feeling that you're losing balance, you're falling on one side. E is eye, vision. So you lose vision or you'll see double suddenly out of nowhere. F is face, అంటే facial deviation. మాట్లాడుతున్నప్పుడు you see that your face is getting dragged to one side. Face అనేది వంకర అయిపోతుంది, right? A is arm. Arm అంటే you're not able to grip objects or చెయ్యి అనేది లేపలేకపోతున్నారు.
Yes.
Right? S is speech, where you're not able to talk or the opposite person is not understanding ఏం మాట్లాడుతున్నారు. T is time, meaning you have to shift this patient immediately to the hospital. అంటే among all these, you may not have all these symptoms. You may have one of these symptoms. So anybody in your family or you, if you have these symptoms, you have to make sure that you reach the hospital within the golden time frame of 4.5 hours. Beyond that also, there is now a newer technique called thrombectomy. Newer in the sense we are doing it, I think, since the past 10 to 12 years. It is called thrombectomy. చెప్పినట్టు వెజల్ ఏదైతే బ్లాక్ అయిపోయిందో, బ్లడ్ వెజల్, we put a wire and we pass through this occluded vessel and we pull this clot out to restore the blood supply. Now this procedure can be done to somebody who has come to the hospital within 24 hours time frame. ఇప్పుడు మీరు 24 hours or 24 hours time frame తర్వాత హాస్పిటల్కి వస్తున్నారు అంటే there is not much that we can offer you. It's only supportive care. Blood thinners అంటారు, రక్తంని పల్స చేసే గోళీలు, but these tablets will take a lot of time to act, అంటే at least 3-4 months. With injections, you'll probably, like I said, 70% chance is there that you'll recover within 24 to 48 hours. And without injection, you're just dragging it for about 3 to 4 months. Right? On the other side, I'll add this, that this injection is expensive. It costs around 20 to 40,000. But that is nothing when you look at it in a broader perspective. if you're paralyzed, you lose out in your job,
Yeah.
on your job.
Yeah.
So you lose income anyway. So you have to put whatever you have at that point of time. You won't have much time to decide. You have to put everything you have, right? To basically avoid being
Functional
bankrupt in the
delays.
future. Yeah.
Yes, sir. Correct.
Yeah.
So window period అనేది 24 hours అని చెప్తున్నారండి సార్.
No, for thrombolysis, for the clot buster injection, it is 4.5 hours.
4.5 hours.
Thrombectomy,
Yes.
for thrombectomy, the device therapy, it is 24 hours.
Okay.
But the criteria for thrombectomy is very stringent. And just because you've come within 24 hours does not mean that you will get this procedure. So you have to follow some criteria. If the patient is filling all this, then only we can go for thrombectomy. Whereas for thrombolysis, the criteria is less stringent. Ante there is 90% chance that మీరు ఈ symptoms, stroke symptoms తో hospital కి వస్తున్నారు అంటే we can thrombolyze you. And you might recover, and there is a chance, 60 to 70% chance that you will recover. That is how the window period is important. And to answer your question, you asked me how many people with stroke come in that golden time frame. I think less than 10%.
Less than 10%. So
Yeah.
that means patients needs to be educated about this window period a lot.
Correct.
అంతే కదా సార్?
Correct. So we make a lot of videos on this every now and then, but I don't think it's reaching the masses like it should, or they're not heeding attention to it. అంటే చాలా సార్లు పేషెంట్ కమ్ విత్ దీస్ సిమ్టమ్స్ అండ్ వీల్ ఆస్క్ దెమ్ ఎందుకు లేట్ వస్తున్నారు, యూ నో దిస్ guy is not moving his right upper limb and lower limb, still you took a day to come get him. They'll be like, లేదు sir, last night he did not sleep properly, we thought he's become weak because of that, or he had fever, that's why we thought he has become weak. So if you have a doubt, no matter what he has gone through, no matter he was stressed, he did not sleep, he did something, whatever, if you are having these symptoms, don't diagnose it by yourself. Get the patient. It is our job to diagnose. It is our job to give injection or not. So this thing needs awareness on a larger scale, especially in a country like India, where it probably has become a stroke capital after diabetes and Alzheimer's disease, like that.
సో మన చేతుల్లో ఉన్న గోల్డెన్ టైం ఏంటంటే ఈ విండో పీరియడ్ అని చెప్తున్నారండి సార్ ఇస్ హైలైటింగ్ ద ఇంపార్టెన్స్ ఆఫ్ విండో పీరియడ్ హియర్. అంటే మీకు నడవడం ప్రాబ్లంగా అనిపించినా కానీ, మాట తడబడినా కానీ, మీకు ఏదైనా కన్ఫ్యూజన్గా అనిపించినా కానీ, కన్ఫ్యూజన్ అంటే మామూలు జనరల్ కన్ఫ్యూజన్ కాదండి, మీరు ఏదైనా సరిగ్గా ఆలోచించలేకపోవడం వల్ల సీరియస్ కన్ఫ్యూజన్ ఏదైనా వచ్చినా కానీ, డబుల్ విజన్ కనిపించినా కానీ, ఇవన్నీ వార్నింగ్ సైన్స్ అని చెప్తున్నారు సార్. ఇవి వచ్చినప్పుడు వీలైనంత తొందరగా 4.5 hours లోపల కానీ, లేకపోతే తక్కువలో 24 hours లోపల కానీ మీరు ఒక క్లినిక్కి వెళ్ళాలి, ఎమర్జెన్సీ డాక్టర్ని చూడాలి, మీ టెస్టులు చేయించుకుంటే స్ట్రోక్ నుంచి వీలైనంత త్వరగా ట్రీట్మెంట్ తీసుకోవచ్చు అని చెప్తున్నారు సార్. ఎందుకంటే పారాలిసిస్ని అవాయిడ్ చేయొచ్చు అలా అయితే. అంటే అందరికీ అని కాదండి, మళ్ళీ పేషెంట్ని బట్టి క్రైటీరియాని ఫాలో అయ్యి వాళ్ళకి చేశారు మాకు చేయలేదు అలా కాకుండా వాళ్ళకు ఒక క్రైటీరియా ఉంటుందండి, దాన్ని ఫాలో అవుతూ చేస్తారు. దట్ ఈస్ వాట్ సర్ ఇస్ సేయింగ్. బట్ ఆ గోల్డెన్ అవర్, విండో పీరియడ్ అనేది చాలా ఇంపార్టెంట్. జస్ట్ లైక్ హార్ట్ అటాక్లో మనకి ఎలా ఇంపార్టెంటో ఆ ఫస్ట్ ఇమీడియట్గా తరలించడం హాస్పిటల్కి, అదేవిధంగా ఇలాంటి పేషెంట్స్ని కూడా ఇమీడియట్గా హాస్పిటల్కి తీసుకెళ్ళడం చాలా ఇంపార్టెంట్. దట్ ఈస్ ద ఇంపార్టెన్స్ ఆఫ్ విండో పీరియడ్. Yes, sir.
I'll share an interesting story based on this stroke again.
Yes, sir.
So about a year back, I made a video about this already, which is there online. But so there was a patient who had come with a stroke, and he was brought in by the son and the wife, right? He had the symptoms of stroke, right-sided, he could not move, and he lost his speech because of stroke.
Okay.
And they brought the patient about a day later because they did not know that it's a stroke, absolutely unaware, right? So like I said, beyond 24 hours, we can only give you supportive treatment. And the son asked me, sir, we have no idea what stroke is, can you please explain us?
Okay.
And all these things that I told you, I explained him. I sat down with him, I explained him, this is stroke, this is golden period. You have to be here within 4.5 hours. This is over, what has happened has happened. We'll give him the best possible treatment. But the next time, if you happen to see anybody like this, no matter you or any family member, do this. So surprisingly, 3 months later, his mother had a stroke. Same symptoms, I think on the left side, right? And he got the mother to the hospital within 1 hour. He rushed her to the hospital. And ischemic stroke was diagnosed. We thrombolized, we gave her the clot buster injection, and she recovered, I think by 24 hours or so, she was practically moving her limbs normally, almost. So that is the power of awareness. Like, I mean, same family, the two strokes. One guy is kind of bedridden now, but the mother is independent. Like, she is completely recovered. Now she's able to take care of her husband better. So that is the power of awareness.
Awareness, yes sir, absolutely, yes sir. సార్ ఇలాంటి ఎమర్జెన్సీ కేసెస్ అబ్రాడ్ లో అయితే ఎంత టైం తీసుకుంటారు సార్? ఈ గోల్డెన్ అవర్ లో అన్ని చేయరు కదా అక్కడైతే, ఇట్ టేక్స్ టైం.
See, there is a thing called stroke ambulance in the UK. I think it is there in one of the states as well.
Okay.
Where you have an inbuilt CT scan. Like you have a patient suggestive of a stroke, and you call the stroke ambulance. They'll take the patient. Within the ambulance, they'll get a CT scan, and they'll be in touch with the radiologist and the neurologist to see that if the patient can be thrombolized or not, and they can thrombolize within the van. And by the time the patient reaches the hospital, thrombolysis is already done. Right? And I think when it comes to stroke, the abroad people are much better aware as compared to our population. I think because thrombolysis and thrombectomies happen more often as compared to what we are doing in India. Because of lack of awareness, and a lot of patients, like I said, come beyond the window period. So I think they're much better placed as compared to what we are doing.
సార్ ఇలా వాళ్ళకి ఆ సిమ్టమ్స్ తెలిసినప్పుడు వెరీ లిటిల్ నెంబర్ ఆఫ్ పీపుల్ నో దట్ దే షుడ్ గో టు న్యూరాలజిస్ట్.
Right.
ఆ 4.5 hours లో ఆ కన్ఫ్యూజన్ లో వాళ్ళు వేరే ఎక్కడైనా తిరిగి ట్రాఫిక్ లో ఇరుక్కుపోతే ఆ గోల్డెన్ అవర్, I mean 4.5 hours is gone, maybe 24 hours లోపు అయితే చేరుకుంటారేమో, బట్ దే షుడ్ నో దట్ దే షుడ్ రీచ్ a neurologist ఆ టైంలో
As early as possible.
as early as possible.
Again, I mean, it comes down to awareness. They should know who
The
they should go
symptoms
to.
are.
Having said that, I think in the peripheries, a lot of medical people, general physicians are also thrombolizing. So it is easy to thrombolize now because these injections are easily available now as compared to what it was maybe 10-15 years back. Because when I was in a medicine residency, I was working outside. I mean, we used to do night duties for some quick bucks, right? So I was on duty once. There was a patient of stroke again. He had a massive left-sided infarct. He had right-sided weakness. It was progressing in front of my eyes. And honestly, I was not aware back then. I'm talking about 10 years back. Like, I was not aware that there is a thing called thrombolysis. Being a physician, maybe a neurologist would know better what they would have done, but I did not know. And it was progressing right in front of my eyes. We just gave them antiplatelets, and the lady, the wife, she was pestering us. I mean, he's progressing right in front of you, not doing anything. I mean, we are like, we have nothing else to offer. But now general physicians are more aware. They are thrombolizing in the peripheries, but less. What happens a lot of times, these people are like you said, they come from peripheries. Who are coming late are coming from peripheries because there the awareness is probably lesser. Also because this injection carries some risk only. And not everybody who receives this injection will improve. There is also the other side to look at. Ante మీరు ఇంజెక్షన్ ఇచ్చారు, క్లాట్ ఓపెన్ అప్ అయింది. సమ్ టైమ్స్ క్లాట్ కనుక మరీ ఎక్కువ ఓపెన్ అయిపోతే ఇట్ కెన్ బ్లీడ్. It can cause an adverse effect. But you have to take that risk because 70% chance that it'll improve. Maybe 20% chance that it'll cause nothing. 5 to 10% risk that it may cause bleeding. But if you choose your patient well, the chances of bleeding is quite less. So peripheries, they're scared to give this injection because they are not
adequately trained,
you can say, to even look at the possible adverse outcomes, to manage those outcomes. Yeah. So if bleed happens, we know what to do. Like that. So they're not adequately trained, they're scared at the same time. So I think relatively we're doing better, but we can do more.
Yes sir, definitely. So I think that brings down to another question, sir. మీరు ఇందాక స్ట్రెస్ రిలేటెడ్ థింగ్స్ గురించి చెప్పారు, స్ట్రోక్ కానీ ఆటోఇమ్యూన్ ఎన్సెఫలైటిస్ అని. సో ఈ స్ట్రెస్ ని తగ్గించడానికి ఆర్ యూ అడ్వైజింగ్ యువర్ పేషెంట్స్ ఎనీథింగ్ లైక్, అంటే మీరు డైట్ అండ్ ఇలా చెప్పడం కాకుండా ఎక్స్ట్రా కరిక్యులర్స్ ఏమైనా ఇన్కార్పొరేట్ చేసుకోండి అని ఏమైనా మీరు చెప్తారా సార్ డే టు డే పేషెంట్స్ కి?
I mean, I ask them what sort of extracurricular activity they're interested in. If they can paint, I'll ask them to paint. If they can sing, I'll ask them to sing. If they're into sports, I'll ask them to play sports. Like one extracurricular activity that I am interested in, if I'm stressed out, I play guitar. Okay? I'm not good at it. I'm a basic guitar player, but I feel relieved. I feel happy that I'm doing something to. I mean, we are also stressed. It's not like we are not. As a doctor, it's not like you should not be stressed. Ultimately, everybody is a human being. I think.
Papers will say that medical professionals are under more stress.
More stress than probably the general population. And people don't seem to realize it.
Because dealing with the lives.
They feel we're happy, we're running like crazy, everything is smooth. It's not.
So, sir is highlighting the importance of extracurriculars అండి. ఎవరైనా ఏ ప్రొఫెషనల్స్ అయినా irrespective of what you're doing, కొంచెం టైం అనేది మీ ఇంట్రెస్ట్స్కి మీరు ఇచ్చుకుంటే దానివల్ల మీ స్ట్రెస్ తగ్గుతుంది, దానివల్ల వచ్చే రోగాలు శాతం తగ్గుతుంది. సో మీరు స్ట్రెస్ వల్ల ఎన్నో ఎక్స్ప్లోర్ చేసి దెర్స్ ఎనీ ఆఫ్ డిసీజెస్ అండి, దానికి ఓపెన్ అవుతున్నారు మీరు. అలా దాని బారిన పడకుండా కాపాడుకోవాలి అంటే మీరు మీకు కొంచెం టైం ఇచ్చుకోవాలండి ఇప్పుడున్న పరిస్థితుల్లో. దట్ ఈస్ వాట్ సర్ ఇస్ సేయింగ్. ఇన్ ద కమింగ్ నెక్స్ట్ డికేడ్ అన్నీ ఇప్పుడు హోలిస్టిక్గానే ఉంటుందండి అప్రోచ్. మీరు కొంచెం లైఫ్ స్టైల్ డిసీజెస్ గురించి కేర్ తీసుకోండి అనే చెప్తారు, జీరో డౌన్ అవుతారు లాస్ట్కి అక్కడికి. దట్ ఈస్ వాట్ సర్ ఇస్ ఆల్సో టెలింగ్. అందరు పేషెంట్స్కి ఏ డిసీజ్తో వచ్చినా మీరు మళ్ళీ ఇలాంటి లైఫ్ స్టైల్ మోడిఫికేషన్స్ చేసుకుంటే యుల్ బీ హెల్దీ అని చెప్పే పరిస్థితి రాబోతుంది. కాబట్టి ఇట్స్ బెటర్ యూ equip yourself with something which will relieve you, stress buster laga. It could be anything. It could be just sitting with your friends and chatting for 1 hour. That is also okay. Break from the routine. That is what. Break from the routine. That is
absolutely,
what. Definitely. It need not be any other new skill. Sometimes if you are not in a position to go out and get yourself trained with some other new skill, it's fine. Just sit and talk with whomever you want. At least that is also stress relieving only.
Break from the routine, because when you're stressed, stress is your routine. So
stress is the routine.
You have to break from routine.
Yes, sir. Definitely. Right. What do you do, sir, for the stress breaking? Apart from playing guitar, what you said?
I watch movies.
Watch movies.
Yeah. I watch any random movie on Netflix.
Okay.
It kind of distracts my mind. Okay. Usually I watch some sort of suspense thrillers where you have to apply your mind. When you're applying your mind is distracted from whatever you're facing. So I watch suspense thrillers or some sort of detective movies. My favorite series, if I could tell you, is Dark. There is a series on Netflix which talks about time travel. It's a crazy series, and you have to be attentive. You cannot miss a single scene. If you miss a scene, you won't understand anything. You have to go back. So Dark I watch every time I'm stressed.
Okay.
I watched it maybe 5-6 times already.
Okay.
It's a 3 or 4 series. Series genre on.
What do you do physically, so for your fitness? You exercise daily?
Yeah, previously I used to work out. I used to go to the gym, but over a period of time I realized that gym is not for me. I get bored of lifting weights, running on the treadmill. So in the past 2 years I'm into kickboxing. I have a personal trainer who comes home every alternate day. And that keeps me active.
It's again very interesting, sir. Ante meeru physical activity also you're choosing the one which interests you.
Correct.
మీరు ఏదో monotony follow అయిపోయి అందరు వెళ్తున్నారు నేను కూడా జిమ్ కే వెళ్ళాలి ఫిజికల్ యాక్టివిటీ అనుకోకర్లేదండి. యూ కెన్ డాన్స్, యూ కెన్ డూ హిట్ ద జిమ్, ఆర్ యూ కెన్ డూ ఎనీ అదర్ చాలా రకాల మార్షల్ ఆర్ట్స్ ఉన్నాయండి. అండ్ ఆల్సో యూ కెన్ పిక్ అప్ ఎనీథింగ్ విచ్ ఇంట్రెస్ట్ యూ. వాకింగ్ చేయొచ్చు, జాగింగ్ చేయొచ్చు, మ్యారథాన్స్కి వెళ్ళొచ్చు. యూ కెన్ డూ ఎనీథింగ్, బట్ యూ హ్యావ్ టు డూ సంథింగ్. దట్ ఈస్ ఇంపార్టెంట్. Physical fitness kosam and also for the mental fitness.
Correct.
Yes, sir. And sir, there are a few questions which I just wanted to ask you on a briefer note. So, are we actually damaging our brains with modern lifestyle habits like poor sleep? Sleep gurinchi meer stress chesi cheppali ante what is your take about it?
See, to be honest, I myself am a bad sleeper. Right?
Bad as in light sleeper, sir?
No, not light. I sleep late.
Okay.
And this I got through my intermediate days. I used to sleep late because I used to feel that my mind is more active in the nights. I used to find peace in the nights because there's nobody.
I think this is a common thing for many medicos, no sir? Night time చాలా బాగా చదివితే ఎక్కుతుంది తలకి అని చెప్పేసి చాలా మంది అలా చదువుతా ఉంటారు.
Correct. So that kind of got carried to my 30s, right? So I think sleep is important in a way that personally I felt that my mind is not as sharp as it used to be about 15-20 odd years back. Of course, age plays a role here, but I think it is not as sharp because of my sleep pattern. So you should sleep at least 6 to 7 hours a
You
day.
are actually sharp, no? So you are the sharpest, I know.
I'm the sharpest, but I could have been more sharper.
Okay.
I think
We don't know.
if I slept well.
Okay.
Yeah.
Mhm.
So
Okay.
yeah, so sleep is important in a way that there is a cleaning system in your brain.
Mhm.
It's called glymphatic system.
Lymphatic system.
Glim,
Yes.
G starts with the glymphatic system.
Glymphatic system.
It's a cleaning system anamata. So when you sleep in the night, cleaning system అనేది activate అవుతుంది brain లో. What it does అనేది all through the day you have a lot of this toxins or proteins getting accumulated around your brain. Like one of them is beta amyloid, which is a protein for Alzheimer's dementia, right? So this beta amyloid అనేది night time clean అవుతుంది through this cleaning system only when you sleep.
Yes, sir.
సో ఇఫ్ యూ డోంట్ స్లీప్ క్లీనింగ్ సిస్టమ్ అనేది యాక్టివేట్ కాదు అండ్ బీటా అమిలాయిడ్ అనేది మీ బ్రెయిన్లో స్లోలీ ఓవర్ పీరియడ్ ఆఫ్ టైం అక్యుములేట్ అవుతుంది. Eventually you will be at risk of a condition called Alzheimer's dementia. So memory loss basically. So that is how sleep is important. A lot of people say that no, we just sleep 3 to 4 hours a day and we are quite active the next day. There is an entity, people who can sleep less and be active, but they have a genetic factor behind it. I think 1 to 2% of the world population has it.
Okay.
Where they can sleep less and be active. But rest of the population, if you look at, you can say now that I'm sleeping 4 to 5 hours and it's not causing me anything. But long run lo meeru kanaka chuste, it will about 50-60 years of age, at that age, you will see problems. You will have memory problems. You will have loss of attention. You will have visuospatial disorientation. You go out and you have confusion on how to go back home. So all these things will come into picture. At the same time, if you sleep well, you have a good lifestyle, this risk of dementia anedi age related, everyone will have some sort of memory loss because your brain is aging as you age. Just like you'll have white hair, your brain will also shrink with time, right? But with adequate, good lifestyle, good sleep, these things can be delayed by at least 1 or 2 decades. Even though you might be at risk of Alzheimer's dementia through genetics, like if your parent has Alzheimer's or your grandfather had Alzheimer's, you will be at risk anyway. But with good lifestyle, these things can be delayed. So there's a saying called genetic holds the gun, but your lifestyle triggers it.
Yes, sir.
So
Very
you
well
can
said.
delay your genes, whatever issues you have with your genes, by a good lifestyle. Eventually it might come out, but you can just delay it at least.
సో స్లీప్ కోసం టాబ్లెట్స్ వాడుతూ ఉంటారు కదా సార్ కొందరు, డే టు డే బేసిస్ మీద. వాట్ ఈస్ యువర్ టేక్ ఆన్ ఇట్ సార్? అసలు అలా వాడచ్చు అంటారా?
Ideally, I think you should look at what is causing your sleep disruption. Work on it first.
రూట్ కాజ్ అనాలిసిస్.
Right? If you're stressed out, maybe work on the stress, right? If you are into smoking, I mean, a lot of people smoke in the nights, and smoking itself can delay your sleep, right? A lot of people use phones before they sleep, right? Phones lo anedi you have something called blue light. Blue light అనేది if you use in the night, blue light ఏం చేస్తుంది అంటే మీ బ్రెయిన్ లో ఒక హార్మోన్ ఉంటుంది, మెలటోనిన్. మెలటోనిన్ is a hormone for your sleep. మీరు నైట్ టైం ఫోన్ వాడుతున్నాగా ఆ బ్లూ లైట్ వల్ల మెలటోనిన్ ప్రొడక్షన్ అనేది హ్యాంపర్ అవుతుంది. సో యూ వోంట్ గెట్ స్లీప్. సో వర్క్ ఆన్ ద రూట్ కాజ్ ఫస్ట్. Everything is good, which is usually not.
Yes, sir.
Everything is good, maybe you can advocate.
సార్, అపార్ట్ ఫ్రమ్ స్లీపింగ్ పిల్స్ కాకుండా హెల్దీ సప్లిమెంట్స్ ఏమున్నాయి సార్ ఫర్ ద స్లీప్? వాట్ డూ యూ అడ్వైస్?
You have magnesium. Magnesium works good for sleep. Not just for sleep, I think it is also working well for migraine patients.
Okay.
We are using magnesium quite often for migraine patients, and they happen to respond well.
Okay.
Especially for somebody who is pregnant, because in pregnancy we are short of options.
Yeah.
We have limited number of options. In those patients we use magnesium, and it is working well.
Okay.
Apart from that, you have melatonin. Like I talked about, melatonin is a natural sleep hormone that gets produced in the night when you're about to sleep. So we have melatonin supplements as well, which may not work as well as a natural production can. But for people who are who do not want to use sedatives, we can give them melatonin supplements as well. Sometimes it does work. I'm using it on my mother and she's sleeping well.
Nice, sir.
Yeah.
So what are the most neglected symptoms, neurological symptoms, which you say that these are warning signs, you can't neglect them like that? What do you think are the most neglected neurological symptoms?
One of the most neglected disease as such is stroke. Again,
Stroke, okay.
I'll come back to stroke.
Okay.
Because I need to increase the awareness, right? So there is an entity called TIA, transient ischemic attack. So you have minor strokes basically. All the symptoms of stroke happen, but you recover immediately. Because you have a clot inside your brain, clot avtundi, adi resolve అయిపోతుంది automatically. So patients will have stroke symptoms, same thing, loss of balance, loss of speech and all that. It will last for about minutes or sometimes an hour, 2 hour, whatever.
Again they'll revert back
they'll
to
become normal.
Oh, that's why they neglect it.
They neglect it.
Okay.
They think maybe I didn't sleep last night, so I have
Or
this.
ముందు రోజు ఏదో పని ఎక్కువ చేశారు దాని వల్ల పట్టేసింది
స్ట్రెస్
అనుకుంటున్నాము.
తీసుకున్నాము, బయటికి వెళ్ళాము, నీళ్ళు ఎక్కువ తాగలేదు, షుగర్ ఎక్కువ అయిపోయింది. All these are the usual
So sugar,
symptoms.
yeah, this brings me to another question. Diabetes ఉన్న వాళ్ళు వీక్నెస్, నమ్నెస్ చాలా లైట్ తీసుకుంటారు. ఇది డయాబెటీస్ వల్లే వస్తుంది, అంతేలే ఇన్సులిన్ డోస్ పెంచేసుకుంటే సరిపోతుంది అనుకుంటారు. సో అది స్ట్రోక్ కి కారణం అవుతుంది అనుకుంటున్నారు సార్?
No. That is a different entity altogether.
Okay.
That is diabetic neuropathy. Because of long-term uncontrolled sugars, your nerves will get damaged.
అది ఉంది సార్. అది కాకుండా how much of percentage of diabetes patients will end up in stroke, sir?
And quite common, one of the common risk factors or etiology.
Because weakness వాళ్ళకి కూడా ఉంటుంది కదా సార్.
But this is something sudden, out of the blue.
Okay. Sudden onset is a warning sign.
Yes. Diabetic neuropathy is a slow progressive disease. You will have numbness about an year back, and you will have paresthesias or tingling or burning today. And maybe a year later, you will have some weakness. It's a very slow progressive disease. Depends on how bad or good your sugar control is.
Okay.
Whereas stroke is sudden. Okay, the word stroke comes from strike. It strikes you like that. So stroke is something sudden. It comes, it goes in a TIA. It comes and stays in a stroke patient, the proper stroke patient. Like that. So TIA is one thing that we neglect. So again, if I can tell you a story.
Yeah, please sir.
There was a patient, 42-year-old male patient, uncontrolled diabetes, a smoker. He happened to have these symptoms of TIA. He was getting one-sided weakness and loss of speech. Lasting seconds is back to normal again.
Lasting just for seconds?
Seconds.
Okay.
Not even minutes, seconds. Like 1 second, 1 or 2 seconds, we were not able to lift his hand, and in next 1 minute is normal. So he did not know, obviously, that it's a stroke.
Maybe
this happened,
most of the time psychosomatic అని కూడా అనుకుంటారు.
They'll same thing, stress ఉంది, పడుకోలేదు, ఇది అది, had a fight with the wife, something. These things will be there. So he ignored it forever. Practically he had about 20 to 25 episodes of these symptoms. He neglected. Eventually, I think a month later or something, he had a proper massive stroke on one side. And again, he came beyond window period, so we could not do much. Same thing if he would have come about, I mean, whenever these symptoms had been troubling him, I think we would have treated him better. That to a young guy who's in 40s. So and now I think he has partially recovered, but he would have if he had come to the hospital when he had the symptoms initially. So TIAs are practically neglected. They are neglected even more than stroke symptoms. Stroke, at least it is there in front of your eyes. I mean, you see it. TIA is what the patient experiences. By the time you reach the patient, sometimes they recover, right? So TIA is, I think, I mean, the awareness about TIA is much less as compared to stroke.
Stroke, yeah.
Right.
Yes, sir. Sir, I would like to ask about this thing that autism అనేది ఇవాళ రేపు పిల్లల్లో ఎక్కువగా వినిపిస్తున్న టర్మ్ అన్నమాట. సో దానికి ఫోన్ ఎంతవరకు కాజ్ అసలు? Is it true or is it a myth?
Correct.
And how often are you seeing these autism patients in your OPD?
Autism is quite common. Quite common in my OPD. I usually refer them to a pediatric neurologist.
Okay.
But a lot of them have seizures as well, which we treat. Coming to phone and autism, it's a myth actually. that kids are using phone, that's why they have autism, right? There is a very interesting phenomenon when it comes to phone and autism. Here the cause and effect are reversed. It is not the phone which is causing autism. It is the autism which is causing the phone.
Okay.
Right?
Okay.
So child with autism, they are socially inept. Like if you're sitting in front of me, you're talking to me, I can see your posture, I can see your body language, I can understand your tone, everything, I can understand your expression. These kids cannot understand. It becomes overwhelming to them to decode all this.
Okay.
They have absolutely no idea what you're going to talk or how you're going to behave with them.
Okay.
So they find a comfort zone in the mobile. Okay? Because humans are unpredictable. Phones are not.
Yeah.
Right? Phones behave in a way that you want it to, right?
Yeah.
You click on an app, it opens. You click here, it slides. It's kind of
listening to your
to you.
Yeah.
Although it's not a two-way communication.
Yeah.
Right?
It's following your commands.
Yeah. The other thing is, once a kid starts using mobiles, and they have autistic kids, they have specific interest అనమాట. అంటే కొంతమందికి dinosaurs అంటే ఇష్టం. So once they open a video on YouTube about dinosaurs, every other video is about dinosaurs. So they'll be happy that everything they want is there right in front of them. They do not want to look outside. Right? Apart from that, phone gives them dopamine hits. They're happy immediately. Right?
Yeah.
And one more thing is the chaos around the world. They cannot take it. They cannot control it. Because we cannot control what is happening around us, right?
Yes.
They cannot control it more. They do not want to face it. Not control. They do not want to face it. So they know that they cannot control the chaos.
Okay. So they
but the phone lets them do it.
Yeah, they're going into a cocoon with the phone.
Because they're comfortable.
Comfort zone.
Yeah. It is behaving exactly like they want it to. They do not need to understand. I mean, phone is not giving them any indication.
Lots of the adults are also going to that zone, no sir?
Sorry?
Not just children, but adults are also. Before bedtime, most of the adults will just go into their phone, their channel, their cocoon. They are not talking to their spouses also.
Yeah.
That is happening these days. So, is it called as autism in adults also?
No. It's not called autism in adults.
They don't want to socialize. Before sleep, they just want their me time with phone. What is that called as?
See, if I talk about myself, as a doctor, I'm busy all day.
Yeah.
12 hours a day I'm working. I get back home. I want some me time because all day I'm not doing anything for myself. I mean, I'm working for myself, yes. But apart from that, what am I doing? Nothing. I want some dopamine hits as well. Scroll.
Yeah.
And this is a common wife complaint that you're not giving time, which is right.
No, adults also, sir. At home, adults, elders, everybody.
Elders also,
Everybody are going into their own. I mean, this is healthy. This is not autism. That is what I mean to say. In children also.
Yeah.
This is. I mean, that is what even you are trying to tell. Now, phone choosing Prati said that is not autism.
Yeah.
Phone is not causing autism.
I'll add there that phone may not be causing autism, but it will cause speech delays and
speech delays. Okay.
Because the more the kid is interacting with the phone, the less is interacting with the outside world. So when a child starts talking or babbling, call it, with the mother or the father, it's a two-way communication. Okay? He blabbers something and the mother responds in a way, and that loop eventually will help them develop some sort of language. It's a two-way communication. Phone does not do that. Phone is a one-way communication. Phone is talking to you, not talking to the phone. Right? So because of that, their speech will get delayed by a year or so. So a lot of patients' mothers come to me saying, he is probably autistic. He's not developing language and all that. But history is this, that they put him on phone.
Yeah.
Because it's easy, I mean, to distract the kid. You do not want to, you cannot be there all the time with the kid. The kid is crying and you just hand over the phone and he's happy with the dopamine hits. So like that, a lot of parents, sometimes it's a glory factor, not glory factor, they're happy that the kid is able to operate a phone at the age of 2. At the age of 2, he's able to scroll. At the age of 2, he's able to open YouTube and all that.
Yeah.
But that is bad for the kid.
Yes.
for his language and speech. So mobiles do not cause autism, but it will definitely delay their speech and language. Coming back to adults, so I think we are also behind dopamine hits. We want to feel some
But how much of dopamine hit is healthy from the phone?
I think everything in moderation is good.
Moderation.
I'm not saying you not use your phone at all, but try to use it in moderation. Try to interact with your wife or husband for that matter, and try to play with your kid as well. And try to use your phone in moderation, and try to avoid using it in the nights. Like I said, it will disrupt your sleep
Melatonin.
cycle. So everything is good in moderation.
So what exactly is autism, sir? Because you're saying what is not autism. Now what is autism?
Autism is not a single symptom. It is a spectrum of disorders. And the foundation for all this is social ineptness. Like they are socially weak. The foundation is this. Beyond this, they'll have a lot of symptoms, depending on the cause. Sometimes it is genetic, sometimes it is metabolic, sometimes it is idiopathic. So like that.
So how do you treat those kids, or autistic kids?
See, basically, if I'll tell you what, a lot of parents are in denial that their kid is autistic. And they do not accept initially. They'll be like, no, this is not autism. He's like that, he's normal. They'll drag it forever. They are in denial forever. So they bring the kid late to our clinic or a pediatrician's clinic. So the treatment is delayed. In these kids, you can do what is called as cognitive and behavioral therapy.
Okay.
What exactly they do, I mean, it is not my font as such. It is taken care of by child psychologist, pediatric neurologist. We usually refer them to these specialists. But we can as well diagnose it, like I said. If a child is autistic, we can diagnose as a neurologist. But like I said, treatment is delayed because the parents are in denial. If you happen to intervene early with cognitive therapy, behavioral therapy, these kids can improve over a period of time. If not normal, at least close to normal.
Yes. So some patients come to the OPD saying that they know that నాకేదో దిష్టి తగిలింది అందుకనే ఇలా బిహేవ్ చేస్తున్నాను, or attenders will be saying వాడికి దిష్టి తగిలింది అందుకని ఇలా బిహేవ్ చేస్తున్నాడు. You will get MRI scans done or CT scans done. You will see nothing for supposing that patients. How do you convince them that అది దృష్టియా కాదా? Actually వాళ్ళు ఓపీడీకి ఎందుకు వస్తున్నారో కూడా తెలియదు. They already come with the diagnosis that దృష్టి వల్ల, చాతబడి వల్ల ఇలా అవుతుంది అలా అనుకుని, అలా అందుకని వీక్నెస్ వస్తుంది, పారాలిసిస్ వస్తుంది. How do you treat that patient, sir? And actually మీకు ఆర్గానిక్ గా కాజ్ కనిపిస్తే you will treat that way, MRIs and
correct.
Otherwise how do you explain that?
No, see, by the time these patients come to you, they would have gone everywhere. To a Baba, or to a psychologist, to somebody elder in their fraternity and all that. They would have tried everything already. So they are kind of auto-convinced that it is beyond disti or whatever. Back of the head, it is still there, but they want your opinion that it is or it is not disti. So they are already partially convinced that this patient needs some sort of investigation, MRI or other blood tests. But it's not that difficult to convince them. I can as well tell them that if this is normal, it is probably disti, which is obviously we do not believe in it. But to convince them, they can tell that this imaging modality will help us differentiate a disti from non-disti, right?
Yes, sir.
Right. So, like I said, they are usually auto-convinced.
Okay, how do you treat them, sir?
Depends on the cause again.
Symptomatic.
If these symptoms are acute, it is usually a viral infection or something. Sometimes fever as well. If it is something subacute ante konni months nunchi ila jarugutundi ante it is sometimes autoimmune encephalitis. Chronic, it is lasting forever. There is usually some sort of psychogenic factor, stress, or some sort of marital issues or some sort of financial issues and all that. So stress, again, it is kind of underlooked, but stress can cause anything in neurology. Any symptom, practically any symptom. If you are stressed out, your brain makes you believe that you have this symptom, right? You have headache is not there, but they feel it is there.
And because they keep on taking tablets, dart every time, or Dolo or anything else.
It is not structural. It is the brain which is making them feel that it is there. It is a functional problem rather than a structural problem. And like you said, they take painkillers forever before they come to us, like that.
So coming to migraines, sir, migraines in young adults, they are becoming increasingly popular now. So do they have to see or they shouldn't see a neurologist? What do you say?
I mean, obviously, if you have headache which is bothering you, you should come to a doctor, a neurologist. Better to see a neurologist. But not every headache is a migraine, and not every migraine is bad, right? So, how to differentiate another headache, serious headache from a migraine or other types of headache? So, if you look at migraine first, we usually have symptoms. Symptoms anedi you'll have headache. Half of your head is involved.
Okay.
Half of your head is paining. You will have photophobia. You cannot tolerate lights.
Lights, yes, sir.
Sounds ni tolerate cheyaleru. You will have vomiting sensation. You cannot move. Right? It is sometimes disabling. So if you happen to fit in this criteria, you are probably having a migraine. Okay? Apart from that, there is another common entity that we see regularly is tension type headache. So you'll see a band-like sensation around your head, like something is around your head, which is kind of constricting your head. So that is tension type headache. Again, this is quite easily treatable, not serious. When should you think of a serious headache? What are the red flags? If you have a headache, which is the worst kind of headache, you never face this headache in your life. It is coming in a jiffy, it is shooting up in seconds, and you're probably collapsing. So sudden sharp headache, which you have never experienced in your past, is called a thunderclap headache.
Thunderclap headache.
Thunderclap anedi, it happens because of a bleeding vessel. Ante raktanalalu, again, it bleeds. So because of that, you have it. It is a serious kind of headache. You have to see a doctor, preferably a neurologist, immediately, right? Apart from that, a lot of time patient comes to our OPD saying I have this headache, and I Google the symptoms. It is a tumor. I need a CT scan.
Oh yeah, recently I have seen, sir, my colleague's relative also diagnosed in the last stage the tumor in the brain. Otherwise, she was symptom free.
Correct. So as such, brain tumor causing headache is quite rare. Okay? Most of the times it is migraine or tension type headache. So when should you think of something other than migraine or tension type headache? So if you have, apart from headache, if you have symptoms like loss of balance, మీకు విజన్ ప్రాబ్లమ్స్ వస్తున్నాయి, సరిగా కనపడలేదు, ఆర్ డబుల్ కనిపిస్తున్నాయి.
Same again, be safe symptoms type.
Not really, there are other symptoms as well. Headache which is worse in the morning. పొద్దున లేచినప్పుడు you're feeling worst kind of headache. You're not able to get up from your bed. Or you had a seizure episode, right? Or headache which is the first of its kind in an elderly patient. Elderly patient, 50 plus, never happened to have headache in the past, comes to you with a headache, you should image them. Because it is usually not the primary headache, that is migraine or tension type headache. So if headache has all these symptoms associated with it, which I call the red flags, you should see the neurologist and you should probably get an imaging done.
Yes, sir. And sir, seizures వచ్చినప్పుడు చేతిలో keys పెట్టడం is also a very famous myth.
It is quite irrelevant actually, and it did not come overnight. It is basically a myth that has run beyond centuries, starting from I think 400 BC, if I'm not wrong.
400 BC.
Yeah, it has been happening. So I think I'll talk about it. So traditionally, we did not know that fits is coming from the brain. You are shaking like this in front of others, and they used to think that this is something related to demonic possession or spirits. Buri atma ka saya. What do you call spirits in Telugu? Atmalu. So it's something related to Atmalu over centuries, right? So back then, iron was considered a precious metal. They used to think that iron has the capacity to ward off evil spirits. So they used to put iron on patient's body, thinking that it will relieve them of that demonic possession. And it has happened like this over centuries. Apart from that, I think in the European countries in the past, the cross the Christians carry was made of iron. So they used to perform exorcism. Exorcism ante basically, I don't know what to call it in Telugu.
దయ్యాలను వదిలించడం అంటే.
దయ్యాన్ని వదిలించడం. Yeah, you can
Yes,
say
sir.
that. So they used to perform exorcism using an iron cross. Even in Indian context, if you see, you know Sushruta, right? One of the
Definitely, sir.
Yeah.
I know.
okay? They used to use iron as a drug. It is there in literature that they used to use iron as a drug orally for seizures. Right? They did not know that it is coming from the brain again. They thought iron is good, so you can use it. So like that, it has come to now where we using keys, because at that moment the only iron thing we have near us is keys. So that is how it got carried forward.
Generations.
Yeah. So I think until 18th century, it was not known that fits is coming from the brain.
సో అది పెడితే తగ్గిందా సార్ మరి అప్పట్లో? వాట్ డస్ దట్ లిటరేచర్ సే?
See, basically, no matter what you do, usually fits will last for about less than 5 minutes.
అందుకని తగ్గింది.
Whatever you do,
దీనివల్ల కాదు.
sometimes they hold the patient tightly, sometimes they put iron, sometimes they put some sort of what do you call water, holy water.
Water, yeah.
No matter what you do, it will subside on its own. It is a natural course of a fit. It will subside. Okay? It is meant to subside. So what we think, we put iron, we put keys, that's why it got subsided. And they say it confidently, sir, he had a seizure, luckily I had a key in my hand, I put it and it got immediately subsided. So that is a natural course. That is a myth, absolute myth. Apart from that, they think that an iron can ground the seizure. Ground in the sense, they think that, of course, fits is electrical activity coming from the brain. They think that iron can, neutralize that current by eliminating it. So, like that. So, it's an absolute myth. Stop doing it. Because we had a patient about a year back, I think again, who had a laceration because of the key. It got controlled, obviously naturally, but it was not. He had an injury as well. It can cause injury, so you should avoid using it. Absolute myth.
Yeah. Also, sir, seizure వచ్చిన తర్వాత వెంటనే వాటర్ తాగిస్తూ ఉంటారు. That is also
No, you should not put anything orally.
I think we should educate about that.
So what happens when you are seizing? Your airway reflexes are gone. Airway reflex ante normally migudunnappudu or something is going down your throat. You have a reflex which protects it from going into your lungs. That reflex is gone because they're practically unconscious. You put something through their mouth, it goes into the lungs, and one pneumonia vastundi. You are trying to treat something and you're giving him something else, right? So you should not put anything orally.
Yeah, water taginchudani.
Absolutely, not even tablets. You cannot even give
tablets kuda ivvadu.
Nothing orally. Of course, we have some sprays now. We have midazolam sprays, which can be given nasally, which can reduce the total seizure duration by maybe a minute or so.
So smartphones are changing the attention span permanently. Is that true or not?
Again, I would not say permanently, maybe temporarily. If you work on it, you can reverse.
Yeah, we can still work on it and reverse it. So that is a myth again.
Yeah, it is a myth.
Smartphones era వచ్చింది, attention span తగ్గిపోయింది. It's not true.
No, eventually, if you do not work on it,
we are not working on it.
It will be difficult for you to get out of it. I would not say permanent again. It will be difficult for you to get out of it. Because now in the era of reels and shorts, you want everything in 3 seconds, within 3 seconds.
Yes, sir.
You want instant gratification. Like, there is a concept of hook on this reels. If I'm not sure if you know it, like within 3 seconds, you should impress me. Otherwise, I scroll behind you, past you, right?
Yeah.
So people work on their hook a lot. Some nonsense they'll put in the first 3 seconds to grab your attention.
Later will be nothing.
Later on there'll be nothing. Practically nonsense.
Yeah. Yes, sir.
So you're used to this 3-second dopamine hits. You should get out of it.
Get out of it. Yeah. Yes, sir. Can diet influence neurological diseases?
Oh,
Is that
yes. Yeah.
True. Yes, sir. How much, sir?
Diet can influence a lot of neurological diseases. See, if you eat junk again, you're at risk of obesity.
Yeah. For example, chips, sir. Chips are
all
very
this
bad.
ultra processed foods, chips or Maggie, or these beverages, or the chocolates for that matter. All these things can play with your brain. If not now, later on.
Later on, exactly. ఇప్పుడు తింటున్నాం, హెల్దీగానే ఉన్నాం అనుకుంటాం, కానీ
Correct.
eventually it will take a toll on our health.
Correct.
Yeah,
Because there is this observation that after 90s, 1991, 1992, that is when economic liberalization of India happened. We invited a lot of foreign companies into investing in our country.
Okay.
You had KFC, you had Burger King, not Burger King, you have Pizza Hut, Domino's, Pepsi, Coke, all these food joints.
Yes.
After that, there has been an increase over a period of time in these metabolic syndromes, diabetes, hypertension. So there is you have this
What you're trying to refer?
evidence, yeah.
Evidence-based studies.
You have this evidence behind you, right? So how do they do it? See, your gut produces a hormone called serotonin. Serotonin is important for your attention and memory. So if you eat a lot of junk, you will destroy a lot of your gut microbiome, good bacteria, which produce serotonin. So over a period of time, this microbiome is practically gone. Serotonin is getting produced less. You lose attention and all that. Apart from that, if you eat junk, you are at risk of hypertension, diabetes, obesity, and whatnot, eventually contributing to your overall risk of stroke and other neurological diseases.
సో గట్ మైక్రోబయోమ్ గురించి మళ్ళీ సార్ స్ట్రెస్ చేస్తున్నారండి, హైలైట్ చేస్తున్నారు. వాట్ యూ ఈట్ ఇస్ వాట్ యూ ఆర్. సో దట్ ఈస్ వాట్ సార్ ఈస్ సేయింగ్. Diet is also very important. It leads to many types of neurological disorders also. That's what sir is saying. So what is that one habit that Indians are neglecting which is leading to serious neurological conditions?
Two things I'll say. One is sleep. They're not sleeping well. They're not sleeping on time.
Okay.
Second is they're not working out.
Working out.
Yeah.
So,
exercise is equally
compared to
important.
Westerners, I think we Indians are neglecting on sleep also. Yeah, they have work-life balance very perfectly coordinated. We don't.
I would add one thing here. In India, it is glorified that you're working hard.
Yeah. Yes, sir.
You're working 12 hours a day. You must be doing good. You must be famous.
Yeah.
Especially in doctor fraternity, he's working 12 hours a day. He's seeing so many patients. He must be quite famous. But ultimately, you're damaging your brain.
Yeah. Down the lane,
it will affect you.
it will affect you. Yes.
Yeah.
So putting a full stop at some point in the day and giving it to sleep is very important.
Very, very important. Again, I'm advocating all this. I should be following it. I may be doing it partially, but I'm working on it.
And also working out. Westerners are working out like
Absolutely.
they take their health very seriously compared to us
Absolutely.
Indians. So we should make it a part of our lives in order to decrease the encountering with the neurological disorders. Maybe.
Right.
Meer kuda ade
It's very
cheptaru.
important to.
Yeah.
I mean, if you walk half an hour a day, I think you will ward off a lot of neurological diseases in the future.
Yeah.
It's like compounding returns of an investment mutual fund.
Yes.
You will have returns which is proportionally much higher than you can expect.
Yeah. సార్ లాట్ ఆఫ్ ఎల్డర్స్ మోకాళ్ళ నొప్పుల వల్ల నడవలేకపోతూ ఉంటారు. వాళ్ళు ఏ టైప్ ఆఫ్ ఎక్సర్సైజ్ చేయాలి సార్ టు బీ ఇన్ అ హెల్దీ physically fit form?
I think one exercise they can do is cycling, which
Cycling
can strengthen. They can
మోకాళ్ళ
strengthen their.
నొప్పులతో కూడా they can do that.
They can do cycling
Okay.
in the not in the late stages, at least in the
Beginning
one or
stage.
two, stage 1 or 2 or third stage, to strengthen their quadriceps muscle. I'll tell you why it is also important, because later on it require knee transplant surgery, the TKR. If their muscles are strong, the quad muscles are strong, and they'll have better recovery in terms of overall mobility or overall range of motion. If their joints were active or if the muscles were strong before or prior to the surgery. So not just at the moment, it will also help them in the future if they're going for a surgery.
సో ఫిజికల్గా ఫిట్గా ఉండడం ఏ స్టేజ్లో ఉన్నా ఇంపార్టెంట్ అంటున్నారండి సార్. మీకు ఒకవేళ మోకాళ్ళు కోఆపరేట్ చేయకపోయినా మీరు ఎంతో కొంత మూమెంట్ చేయడం వల్ల మీరు ఒకవేళ మోకాళ్ళు మార్చుకున్నా కానీ మీకు అది పోస్ట్ సర్జరీ రికవరీ కూడా తొందరగా అవుతుంది అండ్ హెల్దీగా ఉంటారు. అండ్ దట్స్ వాట్ సర్ ఇస్ సేయింగ్. సో దట్ ఈస్ హౌ దట్ ఈస్ the level of impact your physical fitness will give on your post-surgical recovery also. So if you were not a neurologist, what would you have become?
Like I said, I think originally I wanted to become a
Scientist. Yeah, you told.
aeronautical
Then
engineer
surgeon,
and
you
all that.
told. Yeah.
Surgeon, all that.
Then neurologist. Yeah.
But if you give an option to me to go back in time time travel, I would choose neurology again.
Again, neurology.
Again.
Yeah.
But let's say I do not belong to a doctor field. I think at this point I feel that I can be a writer. I can maybe write stories or dialogues for movies. Maybe I can do that.
So apart from being a passionate brain specialist, he also is a passionate writer, and he has another special side interest.
Yeah,
Maybe
I'm
if not now, you wanted to take that down the line.
Maybe I would.
Yeah.
I'm not taking it up actively. I'm not writing anything.
Yes.
But I think I could be one.
సో ఎవరికైనా ఒక పర్సనల్ ఇంట్రెస్ట్ ఉంటే దాన్ని మీరు హాబీ లాగా పెట్టుకోవచ్చు. దట్ విల్ బి యువర్ హెల్దీ స్ట్రెస్ బస్టర్. దట్ ఈస్ వాట్ సర్ ఇస్ ప్రాక్టికలీ షోయింగ్ us with his personal interest. That is the reason for me to ask this thing అండి. ఇది నేను కాకపోతే ఇంకేం అయి ఉండొచ్చు అనేది మనకి ఎప్పుడు బ్యాక్ ఆఫ్ ద మైండ్ అది కూడా ఉంటే we will start enjoying our life more. Because we always know what we can do apart from this. So that మరీ సీరియస్గా కూడా మనం చేస్తున్న దాంట్లో వెళ్ళిపోకుండా we can give some more time for ourselves, for our family and everything. Because that is the only one thing is not life. It is always holistic. It is a complete life. అని ఎప్పుడు అంటామంటే అన్నీ చూసుకుంటున్నప్పుడు మన హెల్త్, మన మెంటల్ హెల్త్, ఫిజికల్ హెల్త్, ఫ్యామిలీ హెల్త్, సోషల్ హెల్త్, ఎవ్రీథింగ్ విల్ కౌంట్ ఫర్ అవర్ హెల్త్ డౌన్ ది లేన్. ఇప్పుడు కాకపోయినా ఫ్యూచర్ ఒక 1-2 decades తర్వాత it will all play an impact on our brain. అంతే కదా సార్?
Absolutely.
Yeah. So we'll just quickly take a rapid fire.
Sure.
Yeah. So coffee or sleep for brain performance?
Sleep any day.
Yeah. Sudoku or exercise?
Exercise.
Most underrated brain habit?
Sleeping on time.
Okay. Yeah, that is well said, sir, actually. One food you avoid as a neurologist?
I avoid all the
Junk,
ultra processed foods.
Okay.
I mean, not completely. Sometimes I do, but like I said, anything in moderation, it will not harm your brain or body.
Moderation is the very important thing. Most misunderstood neurological symptoms? Again, stroke. Yeah. Also TIA. You said.
Also TIA.
Yeah. Yes.
Also seizure actually.
Also seizure.
Yeah.
One myth about stroke, I think we covered, that keys thing.
Yeah.
Sir, as a busy practitioner, busy neurologist and a famous neurologist, are you able to give adequate time to your family? Because patients will hit to your OPD. Sometimes they come from far distance, and sometimes you have emergency cases to see, and sometimes midnight calls to attend emergencies. Do you think you are doing justice to your family?
No, I don't think I'm doing justice to my family when it comes to time.
Yeah.
Like even if I have time, sometimes I happen to use mobile phone or watch movies, which I should not be, but I'm working on it, like I said. Apart from that, I think as a doctor, I'll tell you, I mean, I think a father's role in their kid's life is kind of undermined. You have a role to play. Maybe it's not projected that well. A lot of mothers complain that it's me who is handling the baby altogether.
Yeah.
But on one side, you have this burden on you to give them best, give them what you could not have in the past, right? Whatever they want.
Yeah.
So you want to work hard for them or for yourself as well, right? On the other side, as a doctor, you know that we are out in the market quite late as compared to the rest of the professions, be it in engineer or other professions. I like put it in one way, when I was in Medicity doing my post-graduation in medicine, one of my friends who is an engineer had already bought a car in the US. I was busy buying a toy car for a bedroom. So you are picking up late because your profession demands it. And by the time you are finishing your post-graduation and super specialty, you are probably beyond 30. And you probably marry late. You are probably a parent during that phase. And a doctor's growth is quite slow as compared to the rest of the professions. You take about a decade to establish yourself, right? So your professional growth is kind of, most of the times, is aligning with your child's growth. And your child's growth is kind of steeper to your professional growth. So by the time you realize, by the time you feel that you've done well, now you can be with the kid, it is already too late. Your kid has evolved through the golden years of their age, and now they are probably looking at the outside world through their lens, not through your lens anymore. Your lens is probably specified, right? But for you, time was money, right? And for your kid, time is emotion, right? You cannot bring it back.
Yeah.
So not that I'm doing justice, but I want to work on it, and you should also work on it. Okay? Yes, your profession is demanding it, that you put yourself out there, run in the rat race. But every now and then, I think you should slow down a bit, look behind you, who is there with you. You cannot leave them behind, right? Either slow down or make them run with you, right? So you have to pick a spot where you're happy in your profession, where your kids happy with you, where your family members are happy with you. You have to draw a line between you and your profession before your kid draws a line between you and them.
Very well said.
Right? So that is how it is important to balance your life, which I'm not, of course, but I'm working on it.
Yeah.
I'll probably get through it.
Yeah, I think you've said it beautifully, sir. Oka father heart enti anedi that we are listening through you now.
Correct.
Yeah, because you are unable to do justice to your kid, but you're definitely working on it. Yeah. That we can.
What happens, like, you do not see your kid for a week sometimes because of your work schedule, and 1 week later they learn something new.
Yeah.
Suddenly you see, when did you start doing it? And you'll feel happy that they're doing it. You will feel sad that you are not there, you are not a part of it. And you will feel guilty that you could not have been a part of it. I mean, you are not able to be part of it. So all these emotions run through our head. We are not emotionless. It's just that we are trapped in that rat race, and we're trying to slow down, we're trying to get out of it.
Is that rat race heavy? Is that
It's
really thing to be taken seriously?
Like I said, you have to know where you should stop. Because there is no end to it.
Yeah, yes, absolutely.
Okay, you will want to earn money, there is no end to it. You will never be like, I have enough money.
Yeah, you should come to a point where you should be grateful
That you have this. Like, you should be satisfied with this and to not look beyond it.
Yeah.
Like, you should put a full stop or a comma at least.
Yeah, that is when you will be able to give complete the next day, isn't it, sir?
Yeah.
I mean, to whatever you can do.
Life is not all about just earning money, right? It's also about earning emotions from your kid or support from your family, I think, or take something that you're interested in apart from your profession, like you're into dancing, I'm into doing sports or something. You should also give time to other extracurricular activities, not just your profession.
Relish in life is important.
Yeah. This holistic approach, you can say, to life. You're doing everything that you want to within that circle.
So one thing I just wanted to ask you is, nowadays we are taking MRIs left and right. Like, if you just go to OPD for anything, I don't know whether consultants are actually advising or patients themselves are getting MRIs done and going. I don't know how much of getting MRIs are actually, because many of the people are just scrolling Google it, getting it done, and then they are going for MRIs.
Right.
Is that real? How healthy is it?
There are a couple of things to look at. Sometimes it is the patient who comes to you saying, I've Googled my symptoms, it is tumor, please get an MRI. No matter what you tell them, you cannot convince them. You have to get an MRI. Second thing, you can say that MRI is being overused.
Overused, yes.
More than they should be. Because clinicians are now a thing of the past. Clinician matlab, you are examining the patient, you are coming to a conclusion and then advising whatever investigation you want, right? Now we become lazy. The era of clinical examination is gone. So just we are saying headache, okay, just get an MRI. You have to ask history. Like I said, warning signs there or not there. What is the history? Are they stressed out? Are they sleeping well? You have to look at all of these things and then come to a conclusion and then advise medications. If they are not responding, maybe you get an MRI after that. If they are responding, maybe you not even advise an MRI. I'll give you one simple example. A lot of times, patients come with vertigo, right? And like I said, vertigo is one of the symptoms of stroke, right? So with simple examination, you can say if it is coming from your brain or from your ear. A lot of people don't know this, but your ear can itself produce the symptoms of vertigo, right? We call it vestibular neuronitis and all that. So with a simple test, knee head impulse test antaru. Patient ni mundu kurchobetti, you ask them to focus on your nose and you tilt their head right and left, you see the eye response. And then you can conclude that it is coming from the brain or from the ear.
Nystagmus or
Yeah,
vertigo.
no matter how bad their vertigo is, with this simple test, you can say it's not coming from the brain, and you can as well avoid MRI, which you are not doing. Vertigo, okay, get an MRI. And yeah, it is being overused, but sometimes it is required as well.
Sir, are brain supplements and memory boosters mostly marketed or genuinely useful?
And most of these boosters are company driven, pharmaceutical company driven. But having said that, there are a couple of brain boosters that you can use which have some sort of evidence. And large scale evidence ledu. There is some small scale evidence.
Like Chyawanprash and all you say?
Ashwagandha,
Okay.
it has some evidence. You have evidence for drugs like citicoline, paracetam, some small scale evidence. But something like ginkgo biloba extracts, you heard of, it is a scam. It was proven on a randomized controlled trial,
Okay.
some GEMS trial or something. It has been proven to useless. Apart from that, vitamin E, vitamin B12, folic acid, omega-3 fatty acids, these can be helpful in the early stages of memory loss, early stages of Alzheimer's dementia. But beyond all this, everything is a sham. Yeah, it's a business.
Yes. So I think we have pretty much covered a lot of this subject of neurology, sir. Is there anything you want to add for the audience point of view, from the audience point of view? You want to educate anything, or you want to say anything?
I think audience point of view, I think we've discussed quite well on what all they should be doing and what all they should not be. We talked about stress, sleep,
So
lifestyle.
for MBBS students, sir, who are aiming at neurology, what do you suggest them?
Right. So, I mean, for the students who are taking up medical field as such, not just general medicine or surgery, if you are choosing a medical field, I'll quote Dr. House here, that it is in the nature of medicine that you will screw up one day. You cannot do justice to all patients. You will fail one day, you will succeed another day. But it is in the nature of medicine that you will screw up. And if you cannot accept that fact, you should not be taking medical field.
సో ఫెయిల్యూర్స్కి కూడా సిద్ధంగా ఉండాలి అని చెప్తున్నారండి సార్. మీరు ఏ ఫీల్డ్ తీసుకున్నా సరే, ఈవెన్ న్యూరాలజీ, యూ విల్ బీ ఫెయిలింగ్ వన్ డే అండ్ యూ విల్ బీ విన్నింగ్ వన్ డే. సో ఇట్స్ నాట్ ఆల్వేస్ ఫెయిల్యూర్స్ ఆర్ నాట్ ఆల్వేస్ సక్సెస్, బట్ ఇట్ ఈస్ సమ్ పార్ట్ ఆఫ్ దాట్ అండ్ సమ్ పార్ట్ ఆఫ్ దిస్. సో యూ షుడ్ బీ రెడీ ఫర్ బోత్. దట్ ఈస్ వాట్ సర్ ఇస్. మీరు ఏ ప్రొఫెషన్ తీసుకున్నా, ఐ మీన్ ఏ స్పెషాలిటీ తీసుకున్నా కానీ ఇది వర్తిస్తుందండి అందరికీ. ఎనీథింగ్ ఎల్స్ యూ వాంట్ టు సే, సార్, కమింగ్ టు అకాడమిక్స్ పార్ట్ or coming to the stress part, the toxicity part throughout the residency of general medicine or neurology? How well prepared they should be before getting into this?
See, on the contrary to popular belief that you should not be associated with a toxic department, I think if you're in a residency, in any field, it helps to be in a toxic setup. It will give you discipline, give you the exposure, give you the mindset to face whatever once you come out of your residency. Because you've seen everything. What else can the world offer you that will make you mad? You've been mad already. Nothing can touch you anymore.
Yes, sir. So thank you so much for coming this far and for spending your valuable time with us. I know it is very important. This time means a lot to your kid also.
Yeah.
But despite of that, you came and you shared so much knowledge to educate audience and to educate various the medicos out there. So I think this is a very important thing, and I think we are very thankful to you, sir, for your time and for your valuable insights. Chala thanks, sir, inta valuable information share chesinanduku.
Thank you so much for having me.
థ్యాంక్ యూ సో మచ్.
Thank you.
సో ఆడియన్స్ మీకు ఎలా అనిపించిందో కామెంట్స్లో రాయండి. మీకు నచ్చితే లైక్ చేయండి. ఇంకా ఈ అవేర్నెస్ గురించి స్ప్రెడ్ చేయాలనుకుంటే అందరికీ షేర్ చేయండి. అండ్ థ్యాంక్ యూ సో మచ్ ఫర్ యువర్ టైం. వీడియో పెద్దగా ఉంది కానీ చాలా ఇన్ఫర్మేటివ్ పాయింట్స్ ఉన్నాయండి ఇందులో. మీరు మొత్తం చూస్తే కనుక మీకు చాలా విలువైన ఇన్ఫర్మేషన్ ఇందులో దొరుకుతుందని నేను అనుకుంటున్నాను. థ్యాంక్ యూ సో మచ్ అండి.